As you're getting settled, there have been some questions about the Wi-Fi and the password, because we would love it if you could tweet about the event this morning. So that is available for you on the slides here. You can see where those are posted, and the information is there. Thank you. Okay, so I think without further ado, we'd like to open the PMNCH Annual Accountability Breakfast. And it is our honor and our privilege to have with us today Madam Machel Bachelet, who will make some opening remarks.
Thank you. Good morning to everyone. Well, as the PMNCH board chair, I'm really delighted to open the annual flagship PMNCH Accountability Breakfast alongside the 73rd United Nations General Assembly. Now more than ever, we must come together to ensure that women, children, and adolescents receive the global community's attention. Improving the life of women, children, and adolescents everywhere means ensuring their human rights. Also, as the UN High Commissioner for Human Rights, I cannot overemphasize the importance of addressing human rights as a means of having to strengthen accountability at all levels. In 2018, the PMNCH Breakfast is focusing on efforts to strengthen the 3 R's: results, performance accountability; resources, financial accountability; and rights, social and political accountability. And we acknowledge that this must be done through the partnership of all actors, groups, governments, parliamentarians, media, NGOs, youth groups, the private sector, the UN, donors, academia, and others. This morning, we will come together to hear specifically about why results, resources, and rights are all essential components of strengthening accountability at global, regional, and country levels. You will hear different perspectives from different sectors and different experiences. The DevEx moderators, please stand and show the room who you are. DevEx moderators. We'll be ensuring that we have a lively, engaging event that encourages thoughtful and thought-provoking discussion. We will have interactive polling questions before each panel and opportunities for you to weigh in during the question and answer parts of the panels. DevEx is live casting the event, and it will also be on YouTube. So you who are watching remotely, wherever is watching remotely, please also share your thoughts through this media. We also hope you will leave tweet and at the event using the hashtag accountability and hashtag PMNCH. Thank you all for joining us today at this important event, and we look forward to a very successful and enjoyable breakfast. Thank you. With no more delays, I will leave the floor to Anders Nostrom.
Thank you very much. I'm also very excited to be here. This is really a very, very good tradition to kick off the UNGA week with this breakfast, and impressing to see so many that are here. And of course, this means that there's a great and important engagement for this very important agenda. We had the privilege of hosting the PMNCH board retreat in Stockholm now just a few weeks ago. And I think we all who were there, it was not just that we enjoyed, and some people knows what I mean by that, enjoyed cooking risotto together. But we also had a very engaged discussion about the 6 areas of work that is the different parts and important elements of the Every Woman, Every Child strategy. So the energy and the commitment for actually making a difference was huge in the room. And I think also people really recognized the importance and the strategic importance of this partnership, where you have different stakeholders coming together, and by having different stakeholders with different perspectives, activists, researchers, the UN, business, then we can make a difference. And that came out very clearly from that retreat. As Machel said, this morning is going to be about the 3 R's, the triple R. Tweet that, triple R, that is what this is about. I'm going to speak about a very specific triple R, and as I'm from the Swedish government, of course, I will ask you to do one thing, and I'm going to speak about one thing, and that is about sexual and reproductive health and rights. And my only plea and ask for you is to read the Lancet-Guttmacher report. Read it, use it. And I'm going to tell you why. But before doing that, I think we all recognize, and that is also very clear in this report, that we have made some huge progress in the world during the last 10, 20, 30 years, no question about that. But we still have huge gaps. We have 200 million women that are not accessing modern contraceptives. We have 45 million women that are not having access to antenatal care. We have 40 million that deliver without having somebody who's trained attending. We have 25 million unsafe abortions, and we have now 266,000 latest numbers in terms of cervical cancer women dying. And that is a trend that is going up. And we have roughly equal number of women dying from cervical cancer in the world today as we have women dying from pregnancy-related illnesses. Maternal mortality is going down, cervical cancer is going up. Being a man, I hope next time we will also talk about how many men who are dying from prostatic cancer, which we don't speak about today, but which is also an important element of the sexual and reproductive health and rights agenda. I said this report is important for the triple R, because what this report actually gives us are the triple R. And it's a good also just to understand what does the triple R's mean in practice. This report, when it comes to results, both it provides us now with a new modern definition of what is reproductive health, sexual health, reproductive rights, and sexual rights. So we know what we need to do. But more than that, it provides us also with a package of service that everyone should have access to. So we know what results we should achieve, and we also, based on that, can also have defined targets so we can measure, because that is what accountability is about. So that's the first R. The second R are the resources. This report is also very useful because it actually gives us a figure. How much does it cost? It's been costed a package of sexual and reproductive health and rights services. Very useful to know that. And we know that then for different country settings, what is the actual cost? And also it gives a hint then that, of course, countries, domestic resources is what is paying most for this today. It's going to continue to pay for that. We need a little bit of top up with international resources, but we need also to begin to change our mindset here that it's actually countries and the political decisions in countries that will matter most in order for us to be able to implement this. And the last R are about the rights. Again, one of the triple R's here today, and again in this report. This is a challenging task then, of course. The sexual rights and the reproductive rights are questions across the world today. We need to join hands. They are very strong, and this is very encouraging, movements because of what we see in many countries. So in some way, this has triggered also a lot of work, a lot of commitment across the world, because also when those rights are challenged. And those rights have to do with laws, they have to do with policies, but possibly most important about social values. And I think that is possibly one of our most important tasks, the partnership of PMCH. 1,000 members. We're going to gather in Delhi, and we're very much looking forward to that later on this year. That is actually to be a movement that is fostering the right kind of social values that will enable both men and women to fulfill their rights throughout. Thank you very much.
Good morning, and thank you so much for inviting me here to remind you that without accountability, the SDGs will not be achieved. So EWAC was a pioneer in acknowledging the role of independent accountability. The SG created the IAP after creating the IERG, and our secretariat was lodged within PMNCH at WHO, keeping the independence. Without robust oversight mechanisms and adequate remedies, accountability can just be lip service. IAP has a constructive concept of accountability. It includes effective access to remedies, which is crucial to transform the conditions that prevent people from thriving, the policies, the laws, the institutions. So the IAP report this year is on the private sector. Now more than ever, the private sector is critical to the global strategy for women, children, and adolescents' health, and to the SDGs. The international community is looking to the private sector to help with the SDGs, including with the private price tag, which exceeds public resources. Corporations feature prominently in international policy circles. CEOs mingle regularly with the world's decision-making at Davos and at the UN. The private sector in health is not new. It has saved and improved countless lives. But now it is especially relevant given UHC, the privatization of health services, and the powerful influence of corporate interests in public policy. But who is responsible for holding private sector actors to account? And what are the mechanisms for doing so? The responsibility for oversight of the private sector lies first and foremost with the public sector. Governments from the national and local to the international level are responsible for safeguarding the right to health, both within their countries and the extraterritorial obligations of corporations. But in countries with weak monitoring and regulatory capacities, governments are playing catch up with regulating the private sector's engagement and impacts on health. Poor, rural, and marginalized communities may lack the education and means to protect their health. When the public sector is strong and governments are responsive to their citizens, the private sector can thrive. IAP welcomes effective self-regulation, but accountability must go beyond. Oversight mechanisms, including the judiciary and parliamentarians, are essential. An active civil society and the freedom of information are key to counter the risks of misdirected motives and conflicts of interest, both in public and in the private sector. Health is a fundamental human right, not a commodity. Accountability changes also include the fact that the private sector is vast and complex. It has great diversity in the degree of willingness to be subject to independent accountability and the rule of law. More companies are gradually aligning with the SDGs, but many still are not. The IEP report focused on the for-profit sector, not the broader category, including nonprofit actors. We look at 3 areas of private sector engagement: access to services, access to medicines, and rising obesity and NCDs. We present bold recommendations to a range of stakeholders for holding the private sector to account: governments, EUAC partners, the UN system, donors, and the private sector itself. They will be discussed at the launch of the IAP report this coming Thursday at 7:45 a.m. at a high-level event hosted by the governments of Finland and South Africa at the UN. I hope I have whetted your appetite. You are all invited to the launch on Thursday, but please send an email to IAP by 1 p.m. today if you have not registered yet. Under international law, accountability standards apply equally to all actors, public and private, whose activities impact on people's health and rights. Accountability systems should be endowed with adequate financial and human resources to oversee compliance with these standards. Only in this way we will be able to achieve the global strategy and the Agenda 2030. Thank you.
Good morning. I'm Raj Kumar, President and Editor-in-Chief of DevX. A real pleasure to be here. Listening to Carmen reminds me this is an early morning. UN General Assembly meetings have changed over the years. They used to be really mostly in the Secretariat building, and they were official summit-like events. And every year, I've been coming to this for many, many years, every year the week gets a bit longer, the days get a bit longer. We're at DevX partly to blame for this. We host a number of side events and evening receptions and breakfasts ourselves. But I think it's actually a symptom of something good about the UN General Assembly and what it's becoming. It's becoming a place where there is this measure of accountability. The purpose of this breakfast today is to say that actually we are paying attention to the results, that the Sustainable Development Goals aren't something we're just going to put up as an aspiration and come back in 2030 and see how we did, that we're instead going to have milestones and markers, and we're going to put pressure, and we're going to get together the groups of people who need to be together to show that this is not just an issue of governments and heads of state with that beautiful green marble backdrop at the UN, but instead in rooms like this, we're going to move this ball forward. So I think mornings like this, though they're early, and I appreciate you all being here for it, are important. And they're important that this week has extended in its scope and its mission. I actually interviewed the UN Secretary General just a couple of days ago because I wanted to ask him, how does he feel about a week like this that has expanded and extended so much? What is the narrative he wants to see? And it's very aligned with what we're talking about today. Secretary General Guterres told me, really his main message to all of us in this room and all of us attending the GA this year is urgency, that he feels we're clearly slipping behind on the goals, both the climate agenda and the SDGs, and that if we don't take a moment like this in 2018 to make the focus on urgency, then when 2020 comes around and we see the midterm results or we get further and closer to the 2030 end date, we will simply not be there. So I think that message of urgency I bring from his office here. I think it's important for us today to discuss it. And it also makes me think a little bit about the name, this long acronym that we're all gathered here around, which starts with partnership. What really is partnership about? Partnership can't exist, true partnership, if you don't have trust. And this is a group of 1,000 organizations that are part of this platform. There's no way to work together if you don't have trust. And how do you have trust if you're not honest? If you don't actually issue reports like the ones that are on all of your tables today to say where things are going well, but also where things are going poorly. And sadly, part of our discussion today is to talk about that. So I want to invite our first group of panelists to the stage so we can dig a little bit into how have the results been, and where do we stand and where do we go from here? So I'd like to ask, we have 4 speakers to join us now. Please make your way to the stage if you might. The Secretary General of the International Federation of Red Cross and Red Crescent Societies, Elhadj, my good friend, is here. Maybe the man with more airline miles than anyone I know, and this is a high bar in this group. Thank you very much for making time to come all the way here. Let me ask Chanel Hall, who's the Deputy Executive Director of UNICEF, to please join us as well. And Senator Gabriela Cuevas Barron is here from Mexico. Please join us as well if you would. And to get us started, we have the Assistant Director General of the WHO for Family, Women, Children, and Adolescents, Dr. Princess Nono Simelela. Please join us too. As they are all making their way here, we thought we'd do something a little fun, and I think there's a poll result, or a little poll that we're going to put up on the screen maybe. Here it is, yeah, okay. So, you all have phones. This is the one time besides sending tweets during the session you're allowed to pull it out. Go to this link, put in your conference code. It's quite easy, liveqa.com. The code is PMNCH18. And we've got a question for you. It's a little bit of a trick question given my setup. If you voted for 1, you might be wrong, but I don't want to predict the results. We want to know, how far off do you think we are? And actually, this morning, I was looking at the reports on your tables. The answer's not in there, so don't furiously skip through the report. This is in what you're about to hear from Nono in a moment. Make your best judgment if you can. And after we finish this presentation from Nono, we will come back and let you know exactly where we stand on this particular metric. So I'd like to ask Nono to take us through the Global Strategy Accountability Report. We have just a few slides, and we're going to use those as a kicking off point to what will be a dynamic conversation that it will include questions and comments and thoughts from all of you. So please be engaged in the discussion. Thank you.
Thank you, Raj. Good morning, everybody, our honorable guests, and all the people who are here, colleagues and friends. My job is to just share highlights of the report, the findings of the 2018 report for the IWAC strategy. First slide, please. We know that this strategy is meant to enable us to support women and children to gain the best and to optimize their well-being. The first piece is to ensure babies survive when they are born and that they are born healthy and well, that they thrive, they are given a good environment in which to maximize their intrinsic capabilities. We also want to look at a transforming environment where everybody has an opportunity to be provided with the support they need, to be supported in the issues and the areas where they are struggling, and to ensure that they grow up to be adults that contribute to the economies of their countries. So how have we fared as a global community? Next slide. We always start with the good news. The good news is that there has been significant global progress. We know that the strategy tracks 60 indicators across a wide range of interventions that require an all of government, all of society, and everybody who is concerned about the well-being of children and women, and adolescents in particular, to play a role. Indeed, progress has been made, but for everything that we improve outcomes on, there's a but. There's always a challenge. Neonatal mortality rates have gone down, but progress is slow. And this is where we need to focus. We know that maternal mortality ratio has also declined. If you look, it's taken us 25 years to reduce by 44%. And yet today, 800 women will die today in childbirth, despite this progress. Global adolescent death rates have fallen by 17%, but the sad reality is that in lower middle income countries, young people continue to die. And what was unique about this report is that for the first time, we were able to tell the world why these young people are dying. This is important because what it does is it will help countries to zoom into those areas that the report highlights so that we don't have a one-size-fits-all approach to young people. Young people are not homogeneous. Young people live in different parts of the world where issues are different, and therefore we must tailor-make our interventions. We managed to reduce 25 million child marriages, which is very important because we all know that the beginning of a child being married means that they'll probably have a difficult childbirth. If they survive it, they'll be stuck in poverty because they will not be able to look after the children that they bear prematurely. Next slide. What are the challenges? I have said that neonatal mortality, limited progress. Why are we stagnating? With all the innovation, with all the knowledge, with all the things that we know can be done, why is it that we are unable to support countries to achieve the targets that have been set? Gender inequalities are pervasive, entrenched, and it's a problem. And here we see issues of violence against women and children, especially in humanitarian settings, even in communities. There is a problem here where consistently the most vulnerable are subject to more and more abuse. Humanitarian settings present a brand new challenge. Data shows that right now between 66 and 68 million people are stuck in these places, refugee camps, and that the longest time has now been calculated to be 17 to 20 years that people are living in these settings. So it means somebody can be born, become an adolescent, and actually reach adulthood stuck in a refugee camp. So how do we make sure that these communities achieve, or at least have access to basic services to survive and to thrive? The next slide, please. What's happening with young people? I think for all of us in this room, this is probably the most worrying slide, at least it was for me, to see that in this day and age, we have things that we never truly believed could kill young people. And you can see that at least with the tools we have, we can disaggregate by age and we can disaggregate by sex. But for me, the worrying thing is self-harm. Self-harm in these young people means there's something we are not doing right to support young people to live a full life. And we know that there are many, many societal, economic, and many other challenges that face young people. Here, what stands out for me is because it's girls and boys. And we know that mental health really has taken a back seat in our response. So maybe we need to be doing something a bit more concrete to ensure that that statistic changes, because it means we're losing young people even before they reach their prime. What's the new evidence that's come through? Next slide. The new evidence is extremely helpful. We know now, as I said, what the causes of death are amongst older children, but the ECD agenda has really been radically transformed by the new knowledge that has come through that shows us that if we invest in those first 1,000 days and we support the children under the age of 2 by ensuring that they are provided a nurturing environment, and these interventions are not expensive, that the caregivers are trained to nurture the children, to support them, that we provide the best nutrition, that we can actually triple the dividends for these people. We know that if we do this in a multi-sectoral way, we are bound to sustain the investments throughout the life course. The life course is an important concept that must inform everything we do. We've seen in many countries investments, for instance, in HIV and AIDS, women giving birth to HIV-free children who then subsequently die from any other infectious disease, maybe pneumonia or diarrhea or any other problem. So we need to be really integrating our programs, looking at the continuum of care, looking at the life course, and ensuring that we hold each and every one of ourselves accountable to ensuring that whatever investments are made earlier in life are sustained until these young people have become adults who are able to take responsible choices, who are able to take responsible actions to ensure that they grow up to become like all of us here in this room who've had opportunities to be able to come and sit here. It is our chance now and our mandate and really our moral and ethical imperative that we ensure that many more young people are able to get these opportunities, and that the next generation that will sit here will not talk about the same problems that have been highlighted in this report. Thank you.
Thank you very much, Nona. That was an excellent framing of the conversation we're about to have, which is going to be a little fast-paced. We have 3 panelists, and Nona is joining us on stage as well to continue the discussion. We want to get to all of you, so we're going to keep this as quickly paced as we can. And in the presentation you just heard, there are 3 categories in this concept of survive, where we're lagging behind. We're going to get into those in the discussion, but now we want to talk about those poll results and see how we did. I believe we have them in a slide we can put up. Am I right? Let's see. My singing voice is pretty good if you want me to try something while we wait. Jeopardy music, maybe? Please. Anybody know that can share it with me and I'll yell it out? It's on your table, Grand Central, Wi-Fi password. You're welcome. Okay, so someone might need to help me look at this. Hang on. Okay, 10% of us in the room, and I suppose people could vote who are watching us on the live stream as well. So if you're joining us on the live stream, these may include your votes as well. But 10% of the people who voted think we're on track on the survive targets. 7% think we are 5% off. A plurality, almost half, think it's 15%, and a third, 34%, think we're 25% behind where we should be. This is obviously an educated group, probably many of the authors of the report are in this room as well. So maybe this is not the most direct survey methodology, but yes, the plurality is right. We are off by 15%. That's the lag. It's quite significant if you think about where we are on those targets. And as Nona described, we've had a lot of success historically, but that success is slowing down in many areas. And we're reaching points where the challenges are much more difficult. That's precisely what we want to get into in this discussion. And we're going to talk about three areas: neonatal mortality, gender inequities, and the humanitarian settings that many of these challenges are really based in. And we have an excellent group of people to discuss that. I want to start with Chanel Hall, who is, as I mentioned, Deputy Executive Director at UNICEF, and has spent her career working on these issues, including leading the supply chain, UNICEF's massive supply chain all over the world. So you know very well what the issues are kind of at the ground level, Chanel. How do you look at these numbers and where we are on neonatal mortality? Why is it getting harder?
Well, I think Nono has given an excellent overview. We know that 2.6 million babies die within their first month of life. We know that of that, 1 million take their first and their last breath on their first day of life. And in addition, there are another 2.6 million babies who are born stillborn. So we also know that more than 80% of the causes of this are premature birth, its complications during labor and delivery, and its infections. So sepsis, meningitis, pneumonia. So we have a lot of evidence of what is causing these deaths. But we also know, unlike some of the causes of under 5 child mortality, there isn't a single intervention that's going to break the curve. So we're looking at the need to have a system approach. And if we look at where the neonatal deaths are, of course they are in the poor parts of the country, low-income countries. It's exacerbated by some of the issues that we'll hear in the next topic. Okay, so what do we do? Well, I mean, in many ways, this is why the progress has been slower, because we are talking about a change in the system. So we know we need fixed facilities that are well-stocked, that are well-equipped, that mothers can go to. We know we need trained health workers, including doctors and nurses and midwives. We know we need the medicines. We know, I mean, all of these things, but it's quite complicated. And earlier this month, the Lancet published a report that they had been working on for 2 years that talks about not only having the facilities and the health workers, but that the quality of care is at the essence of this. So I think in the accountability, it's not only looking at is there access, but what is the quality of that access, which is a big challenge. So, I mean, we need to build the systems. We need to hold ourselves account and work with governments and work at the local level. And obviously, the importance of a quality primary health care is essential. And with universal health coverage high on the agenda, it's the opportune moment for us to push this, to push the financing for it, to push the investment that is needed. And to hold ourselves account, so maybe I'll end with one of the importance in terms of accountability is that in addition to this, we also need that births are registered, and that neonatal deaths are registered, and that stillbirths are registered. This is going to help us know where we are making progress. We need to be talking about what we're learning, so looking at the data, see what is happening in locations where the situation is changing, so where the data shows improvement, and learn from each other on this. So it's not easy. That is why it's going at a slower pace. But again, we're probably at this moment where the agenda is so agreed upon politically that now at the implementation point, we should have things clear to really fight for the resource and fight for the investment in this area.
I'm glad you brought up the issue of data, which I think is an underlying theme probably to the discussion today. The World Bank's latest numbers are 1.6 billion people don't have some kind of a government identification. And that is exactly a symptom of the problem you're talking about, that children are born or children die in childbirth, and yet none of it's registered. And without that data, it's very hard to get to the issues you mentioned.
of access and of quality, which remind me a lot also of thinking across sectors of the education space, where for years in breakfasts like this, the thought was we're doing really well. The statistics on girls in school were going up and up and up. But only belatedly did the education community come around and say, well, the quality of much of that education is not what it ought to be. And if I'm paraphrasing Chanel, we need to look at both of those factors together now, or we won't hit the results that we aim to achieve. I want to pass it on to Senator Gabriela Cuevas Barron, who is not only a senator in Mexico, but chairs their foreign policy committee, their foreign relations committee there, so she's thinking very globally in her work. And she's also an advocate on human rights and gender equality in her own country. And so we wanted to ask you to speak on that topic, particularly here. We've heard it twice now, and Anders started us out this morning and mentioned that rights is an underlying theme throughout all of this. And then we just heard from Nono about child marriages and that there are some, 25 million have been prevented since this agenda began, but that is an underlying issue as well. Talk to us about where we stand on gender inequality today around the world. Why is it getting more challenging, and how should we understand it as a part of this overall agenda?
Thank you. Thank you very much for this wonderful invitation. Well, I am not a senator anymore, so I am not the chair of the Foreign Affairs Committee also, but I am a member of the Mexican Congress, which is a very important honor for me. This is the very first time where in Mexico we're having gender parity, and even in the Senate we have more women than men. So we are absolutely happy to say this. I am president of the Interparliamentary Union, and I must say that this organization is a champion on women information about political participation. Particularly, we measure the presence of women in parliaments and also in cabinets. So we develop every year a lot of information which is very useful. You can use it from our website. And why we believe this is so important. First of all, we are truly committed with all women's and girls' rights issues. And I know, I've been a politician all my life, and I know how difficult it is to believe that parliamentarians are useful. But we are. Part of our duties is to ratify international instruments, which is why countries are committed with this agenda into national legislation. We develop and we change and we do national legislation. I believe one of the most important but less underlined issues is that we do budget. And the most important public policy instrument for a country is its budget. In Mexico, we say that the only true love is showed on budget. Otherwise, it's not love. And of course, we do oversight and citizens' representation. So if you really want to change a country's priorities, you need to change and work with parliaments. We can mention some positive and optimistic histories. For example, we have one at IPU with the Parliament of Rwanda. Some years ago, in 2008, they started a bill to work on health and sexual and reproductive health and access to services such as family planning. Of course, it went to the freezer, as we call it in the parliamentary language, and nothing happened. Until some years later, when IPU and the Rwandan parliament started working together. And finally, in 2016, there was a very common and important agreement between women and men, and they finally approved this bill. For the implementation, IPU worked with the parliamentarians, and they even had some workshops with the citizens to explain why this bill was so important. So this is in the side of good news. But what happens, like in the real world, which is almost the whole world? We don't have Rwandas every day. For example, if we see in terms of banking accounts, the women access to banking accounts, we can see more than 1 billion women that are never going to have access. Or if we see, for example, people living in poverty, 70% of them are women. We can go case by case, health, education, housing, even property rights. Almost 90% of the countries present some kind of restriction for women that, of course, doesn't exist for men. Even some developed countries, there are a few surprises. So we really need to understand, first, that, and my country has, it's not only about affirmative action or having legal quotas to make women participate in politics. It's creating a different environment to allow women to have opportunities. That is going to really change the way inequalities are addressed in parliaments and in politics. So this is like a very complicated cycle, but if women are not having, for example, proper spaces for their babies, their children, like schools, safe spaces, they are not going to join politics and they are never going to dream being a parliamentarian. Or if they don't have a job or a bank account, they need to feel safe and then they are going to be concerned about their communities. But if they are not going to politics, nothing is going to change into all public space, public policy, laws, budget. So that's why we are also truly committed with improving and making a lot of awareness in each of the 178 countries that are members in IPU about why women in parliaments are that important. It's clear that there are certain issues that only women parliamentarians are going to address. Neonatal, sexual and reproductive health. There are a lot of these important issues that are never going to be addressed until women are raising their voices in parliament. So that's our responsibility, and I hope one day you have a better opinion regarding parliaments and parliamentarians. Thank you very much for this wonderful invitation.
Thank you so much, and I'm sorry I got your current title wrong, but I would remind the audience that we're just 5 years away from the next Mexican presidential election, so maybe we'll be seeing your name again. Secretary General Elhadj, it seems to me that I mentioned at the beginning you travel a lot, and I mentioned that in part because you were one of the leaders who is really on the ground very often. Every time I see you, you're coming back from another humanitarian response. And there's so many around the world, so many long and protracted ones. It's kind of an underlying theme to the discussion today. I wanted to get your thoughts, and so much of the challenge are in those humanitarian zones as to where are we and where do we go from here?
Thank you very much, Raj. Indeed, there are so many humanitarian settings and situations today, but I think it's important, in a GA week, to remind ourselves and remind the world leaders that those settings are not normal. It's not normal to have women, men, and children in Syria for 8 years, and there is, no solution in sight. That is not normal that the whole generation in Somalia knows nothing but war. It is not normal that a crisis is going on in Central African Republic. It's not normal that a young girl, waking up in northern Nigeria with a greater chance, to be abducted and nobody knows, where they are. It's not normal. It's not normal that every monsoon season, every typhoon season, every hurricane season, become a humanitarian disaster. So we seem to be very good, in describing those situations. We seem even to be very good in predicting them, but we are not smart enough to prevent them from happening. We are not smart enough, to find solution to those problems, when they're there. So women and men and children in those settings, they want peace. They want stability, they want normalcy first. And I think it's really important that we remind ourselves, that. Until that happens, of course, until that happens, what women and men and children in those settings are doing is to wake up every day and then develop their own strategies for survival, build what they call their resilience, but put it simple, trying to find solutions to their problems. And our role, until those bigger solutions are found, will be to accompany them, so in that journey. Well, most of the women and men in those settings, they are first out of sight, they're out of scope, they're not even reached to be accounted for. So then we call it to all of us, and today we need to walk the last mile in reaching them. Well, if that is where the needs are greatest and where the people are hardest to reach are, maybe we should flip it around and make it our first mile of response. To make it our first mile of response, we need to understand really the complexity of those situations. There is something extremely important, and you alluded to it, Raj, at the beginning, that is broken, that we need to heal, and that is a trust. Trust among people, trust between men and women, trust between the rich and poor, trust between governments and the communities. Because in most of those places, where the biggest problems are and the needs are greatest, unfortunately, there is often even not a government or any sign of government. Health needs are great. There are no hospitals, no doctors. Education needs are great. There are no schools. Yet, we have to respond to that. So, like the people in those settings, humanitarian workers and health workers in these settings are also calling for normalcy, also calling for a creation of a safe humanitarian space to operate in. But no, we are targeted, we are being killed. We lose many staff, and volunteers and colleagues, in numbers, that is quite, mind-boggling. I don't want to start counting. In Yemen, I don't want to count what we lose, in Syria. But if you take now the map, of where these highest or most severe health, these health problems are, and then you kind of juxtapose it, with the health, the map, of where those conflicts of humanitarian settings are, most of the time they match. And that shows, that really we need to do things differently. So partnership then is key in that regard. And that partnership, between, of course, ourselves, we all are proud of achievements that are being made and counting either the coverage of a number of children we vaccinate and then women that are accessing health in very difficult settings. But we also have to recognize that no matter what we are achieving, that is not anywhere near the scale and the magnitude of the problems that we are facing. So partnership is key, then to go to scale. Partnership is really key to sustain our response and build those long-term partnerships, because if it is protracted, now the coming in and going out, in a very short term will not cut it, anymore. It is about also putting something extremely important, that should be at the center of what people need, and that will be impacting on everything what you do. People wake up every day and try to recover one of the most important things they lost, and that is their human dignity. And that dignity, that is, of course, addressed, through their health needs, through, the way they can care, for themselves, through also the way ourselves, we have to operate in those settings, in doing it. And I believe that this partnership is one of the most, powerful one, because it put people at the center of it. It put, issues that are related to trust and human dignity. So we are very privileged to be part of it, and we look forward to continuing working together. Thank you.
Thank you so much. That was a very inspiring set of remarks, and I would love to jump right back into the panel, but I want to turn to all of you, because I'm looking around the room and seeing a lot of people who are working on these issues every day, who know a lot about this topic, and I'd love to spend a minute or two, if we can, to collect one or two thoughts or questions. I think we have microphones that can come around. If not, we'll ask you to shout a bit. We do. There's one back there. So any hands? I see one back here. And any others? We'll take a few at a time. This gentleman here as well.
One from the online.
Oh, and one from online. Great. We'll start with those three, please. And just, if you don't mind, state your name, and if you're representing an organization, that would be helpful. And try to keep it with a question mark, if you can, or a period relatively short, given time. Thank you.
I'm Johannes Paulus Imbisalo. I'm originally from Cameroon, and I'm a women deliver young leader. And I'm doing a PhD in health economics, and early childhood development is very, very key to, something I'm very passionate about. But we've realized that just 1% of funding goes to early childhood development, pretty much pre-primary education. Why are governments not investing in those early years? Because there is the data that suggests that the first 1,000 years are very critical. But if only 1% of donor money is going only to that, then there is a problem from the top. Thank you.
Thank you. We'll take this question right here, if we can.
Good morning, everyone. Thanks for this amazing panel. My name is Jean-Paul Laurent, and I'm originally from Haiti and the founder of and CEO of Unspoken Smiles Foundation, a nonprofit that provides access to dental care for low-income community around the world. So my question is, how do you truly measure performance accountability if there is a certain unconscious bias towards some specific diseases, specifically like dental care, as you know, is always neglected as part of some of the early childhood care among the decisions in World Health Organization. Thank you.
Thank you. And we'll take the question from online.
This is from online. It's from Craig Burgess. How can we hold private sector accountable to deliver what it promises to achieve the SDG and UHC goals? For example, there are global shortages of HPV, rotavirus vaccine, polio vaccine, and yellow fever. Despite massive demands, this erodes trust in systems and partnerships.
Thank you for that one. And if we have time, we'll come back with, maybe we have one more? We'll take it.
Thanks. Majid Azadi from Imperial College London. I'm actually representing a new initiative called NCD Countdown 2030. And I don't think at this event I need to say much about the importance of Countdown, but certainly given that the SDGs have broadened the health agenda to include non-communicable diseases, there was a large gap in a mechanism of accountability, and over the past few years, a number of entities, which include NCD Alliance as an umbrella group of civil society entities, WHO, the Lancet, and academics and practitioners around the world have come together and after much thinking, modest scope currently, but large ambitions, we have launched NCD Countdown, and I think I'll leave it at this stage to saying two things. One is that the common interests with maternal children and adolescent health, including both in terms of determinants and interventions, universal health coverage being arguably the most important one that cuts across all of these. And the other one is the very explicit issue that we are focusing on NCDs throughout the entire life course now. So we do track the SDG 3.4 target, but we are also looking at under 30 and including childhood and adolescents and the importance of NCDs. And over the coming months and years, we actually look forward to working jointly and in a variety of ways and having dialogues on both very specific activities as well as the advocacy and policy agenda in what has traditionally been two separate communities. And some of those dialogues are beginning. So go to our website, www.ncdcountdown.org. Email us and explore actually what the early outcomes of the activity are. Thank you.
Yeah, thank you for that as well. I'm gonna just try to narrow the questions a bit given our very limited time, and I want to get Nono back into the discussion, so I'll go to you first. I think our colleague from Cameroon asked a good question, but probably for the next panel. I'm going to push that on. By the way, you are a fellow with Women's Deliver, which is coming up in Vancouver in June of 2019. I know I'll be there. I assume all of you will be there as well. Yes, you can clap. You can clap. And our colleague as well from Haiti asked a question that I would put to the panel. There's been a theme through the discussion about health systems. This is something, Chanel, you talked about as well, that we need kind of a systematic approach. And I wonder, are we facing a challenge as a community that we're still siloing ourselves, thinking about very specific disease interventions or even specific age categories instead of the life course? Nono, you're at the World Health Organization. How do you think about this challenge?
Yes, I think that the challenges of vertical programs are really true. At the country level, ministries implement what they get resources for. And over time, we've seen how we've become disease specific. And I think it is time for us to really look at the continuum of care, to look at integrated service delivery, even if at the global level we each do our specific area. When we support countries, I think we must leave logomania behind, because there's no point in arguing about who's doing what for whom.
Logomania, that's what you called it?
Yes, it's everybody wants their logo on something so the country can see
like
they've
that.
done something, you know? I often say when a woman or a man or a boy or a girl walks into a clinic, they don't look for WHO or UNICEF, I'll call my friends, or the partnership. They just walk in seeking care. And we really must try and integrate, because if we don't, we really are adding more problems. We've got 1 or 2 nurses in a clinic who have to deliver many interventions. That's why it's important, I think, from our perspective, that primary health care must be brought back. And we hope that you'll all come to the anniversary, but that when we leave there, we leave with a commitment to provide comprehensive support, integrated to governance, and we don't force competition for resources. We don't force health workers to move from one program to another because this one is funded well. I mean, there's many places where you've got so-and-so's clinic, this one's clinic, this one's disease. No, you know, people come as one body, you know, and they don't come in bits and pieces. And we need to learn that and be humble about the fact that we really must give up our area and look at who else should be at the table to assist. And therefore, I think the importance of comprehensive care comes up in also the issues of why dental care has not been looked at, is because nobody's funding it, you know. So if there's no money for ensuring this, then it doesn't get done, which is wrong.
Thank you, Jean-Paul, for bringing that idea, this bias, and the idea of dental care to the panel today. Does anyone else want to get in on this topic of systems? Because I also want to move to this question about the private sector role. Maybe we'll, go ahead, please. Asi.
Thank you. On systems, I think it is also important to realize that there are cohabitations of systems. So many people are not necessarily captured by the formal systems, including the formal systems of health. So community systems are also important. So that is the reason why we should also pay more attention on issues like community surveillance. We need to put more attention on community engagement and community accountability, because that is where then you have the spaces and the trust that is required to deal with difficult issues. And it's a difficult issue to do contact tracing when you have an epidemic or you have a pandemic outbreak. It is a difficult issue to send people to treatment centers, at times when we know that maybe, most of them will not come back alive. It's a difficult issue to deal with safe and dignified burials, that we have to conduct when we are dealing with the Ebola outbreak and so. So it's important, again, in systems, that as long as we need to invest in the health systems and then to strengthen them, and in many places to build them because they don't even exist, we should not lose sight of the community systems that needs also to be strengthened and then supported so that we don't have the current gaps and inequalities that we have today.
Chanel, you wanted to get in on this question?
Well, maybe just to add that, over the years, we have seen some of the greatest progress on those areas where we had a proven intervention and there was concerted effort at global level, regional and country level, and there was kind of a laser focus. I think of rollback malaria, I think of many of these things where we saw change, right? So the issue is not that we don't want to know this and have a strong evidence base and passion and commitment around some of the greatest killers of children, some of the big determinants of health, but it's how we convert, what's the convergence of this at the point of the right points in country. And so we all have to take a look at this point, because we know to reach this, the goals, we have to do it differently. We don't want to dismiss all that has happened, because it's been amazing. So now how do we bring that together and build on the strength of that and work more as convergence, if I can use that.
That's a good point to move on to our next and final topic, which is a big topic to address in maybe 30 seconds. We're a little bit over time here, but we want to talk about the private sector. We had a question from online from Craig Burgess about accountability, specifically thinking about vaccines. We heard from Carmen this morning about accountability of the private sector. In my interview with the Secretary General I alluded to earlier, he made the point that there is simply no way we will hit the SDGs if we don't move to more of an engaged partnership model with the private sector. So we all know we need this convergence. We need a new way of approaching. We heard the word trust at the beginning from Asi as well. Are there thoughts here about how do we better engage the tremendous capabilities of the private sector while making sure there is accountability? From any of you. Gabriela, if you'd like, or others. And this will be probably our closing thoughts, so please weave them in if you can and keep it brief.
Yeah, of course, yes, it has to do with trust, but I believe also in changing the way that we are related between the public, private, and social sectors, because each one tries to accomplish their own goals. So we need first, and that's also related to health, first we need proper information. Sometimes we're taking decisions based in any kind of beliefs, but not in science or any way of real data. Second, I believe that's part of a politician's point of view, of course, but we need to change the incentives. Usually, what politicians are trying to maximize is budget, and the private sector is trying to maximize profits. So we need to change the incentives and to make it a win-win situation, which I believe is possible if we make some adjustments. I don't think that private sector is going to say, yes, let's be accountable and I am going to open all my books to what people want to see. But I'm sure that they want to be part of the solutions. And it's true. We only have 12 years to reach the SDGs. And in 12 years, it's impossible to change the world if we are not truly committed with changing our own communities. It's like trying to add community by community. And that's only going to happen with private, social, and public sector working with solidarity and with subsidiarity.
I'm sorry to force everyone to be very brief, but maybe a final thought, and if you can address private sector, that would be helpful. Anybody want to give their last thought? Asi, perhaps?
I think the scale and magnitude of problems that we are facing are forced us all to be a little bit more humble. And that humility, I think, is also building a bridge, with the private sector. That we are not only seeing each other as these are the profit makers and these are the touchy-feely humanitarian people. I think we are developing a kind of a sense of that we all care and care about people. And what is now the best way to do that? In leveraging on each other's strengths. You mentioned procurement and supply management, which is certainly a strength, that through the partnership with private sector we have achieved a lot. Use of technology and, new digital kind of gadgets and other means, to do satellite imaging or use of drones, to access the hardest route. And all those are extremely promising, type of partnerships, that we can build on and continue to reach the largest number of people. But that trust will be at the individual level, and here I would like to end with that. I think leadership is really key. Leadership, from the private sector, leadership, from the all other sectors, to all come together and unite where we all belong to, which is a shared humanity and caring for the people in need.
Thank you. Chanel, a final thought?
Sure. So on this, we know that we can't change the world for good without businesses being a part of it. They already are a part of the fabric of life. When we speak with executives and CEOs, we have really never heard them be more interested and more committed to the SDGs. They want to know what they can do to help. They want to move from philanthropic and charitable endeavors even from CSR to more social business is what they're calling it. So they don't want to have a no profit, no loss. They want marginal profit. They're looking for ways to get to the double bottom line, so just not profit, but also planet, and the triple, so profit, planet, people. And they're not sure what to do. So, and they will find their way to do it on their own. They also have incredible pressure internally from their employees who, to get the best talent, employees want to work for companies who are using their assets to bring good to the world. So I think our community, as has been mentioned, we need to talk about what problems we're trying to solve and ask them how could they be a part of that solution. And we really have a great report to steer us how we do this from the IAP. So it is a different era, and if we are not engaged in influencing them, we're not likely to see the impact that they could bring. So, thanks.
Yeah, thank you for that. I know that it's very easy to suggest that things are moving slowly over time, but if you look at what's happened between the not-for-profit and the for-profit sector, it's really been a massive shift, right? And the next session that we'll be shortly moving to is on finance and financial innovation. But if you look at that side of the coin, we used to have grants and contracts and loans, and then there was business. And it's converging massively, to use your word. We are past, I think, the point of thinking about it. It's happening, and happening at scale. So recognizing that is very important. No, any final thoughts from you as well as we close?
No, thanks. I think for me, a point of departure is exactly as he said, is leadership. I think leaders need to show the commitment as well and be willing to take responsibility and accountability for their citizens. I think there's a big challenge in that we say something and then we do something else. Our leaders take a lot of decisions, many declarations get signed, but then there's no implementation. So for me, before I even go to the private sector, I need to see leadership from our own governments, investing in the right things for their people. Then we can go ask for other people to come and help. But if we don't walk the talk as leaders, then nobody will be interested in our problems.
Thank you. And on that note, thinking about what we all have to do as leaders, at DevEx we've done a reader survey recently, and we saw that 79% of our audience have graduate degrees. And my guess is that even in this room it may be a higher percentage. I know we have a PhD candidate back there as well. We may be very overrepresented in terms of academic credentials, and the maybe natural impulse for people who are in that frame of mind is to look for technocratic solutions. To say, okay, we have a problem, the chart isn't going the direction we want, how do we solve that, where do we intervene? The point, I think, of breakfasts like these, of reports like the one that are on your table, of organizations like the partnership, is that there has to be a mechanism to push for leadership. It's not all about a technocratic solution. In the end, we need to push, and that's why we're here at a week when the world's leaders are here from public and private sectors. We need to use that chance to push. So we will continue that in our next session now, which talks about the financing side of this. I want to welcome to the stage Adva Saldinger, who is DevEx's senior reporter focused on these issues. She is a world expert and someone you've probably listened to and read her work over the years on this topic. So Adva, the stage is yours.
Thanks, Raj. So as Raj said, I've been at DevEx a while covering these issues, and I think this is a really great opportunity to talk not only about what the financing needs are, but how we can ensure that the money that is available, that is raised through private and public means, is getting to where, one, it is most needed, to answer your question about early childhood education and other early childhood investments, but also ensuring that governments, the private sector, civil society are all engaged in ensuring that there is accountability around funds that are being raised, be that through domestic resources or through private companies, are actually being spent. And so hopefully we'll have very lively conversation about those issues. And so without further ado, I'm going to call our panel up. I'd like to call Dr. Gavin Yamey, who has worked on the Lancet Commission for Investing in Health and is the director of the Duke Center for Policy Impact in Global Health. Dr. Miriam Clayson, who's the director of the Global Financing Facility, and Dr. Marianne Etiabet, who's the executive director of Merck for Mothers and the PMNCH Private Sector Constituency co-chair. And Okay, yeah, okay. And we have the Assistant Director of Child Health and Nutrition from Zambia, who is representing the Minister of Health, who unfortunately could not join us today. And I'll also call up Beth Schlachter, who's the Executive Director of Family Planning 2020. She's going to give us, start us off here with a Spark Talk, talking about the 2018 PMNCH report on commitments to the global strategy. Before I turn it over to Beth, we're actually going to take a quick survey question. So hopefully you guys still know how to get there from the first time we did this. But the question we're asking this time around is, how many countries in Africa have met the Abuja Declaration to allocate 15% of their government budgets to health? So go online. I think most of you might know the answer to this, but we'll get there later. But yeah, so take a quick second to answer that, and I'll turn it over to Beth.
Great, thank you. Good morning, everybody. It's a great pleasure to be here with you today to announce the launch of the 2018 strategy on accountability and on commitments for the global strategy. And for the first time, the report was developed jointly by PMNCH and FP 2020. So the report is available online, and this year, for the first time, we're also accompanying that report by 2 deep dives to examine commitments on adolescents and young people and their health and well-being, and also commitments in support of humanitarian settings. So I hope that you'll all have an opportunity to take a look at those reports, and I'm here to share with you this morning some of the key findings. Next slide, please. Well, the next slide, please. There we go. So this year, there were 302 commitments that were made in advance to advance the global strategy, and that's since its launch in 2017, measured to the end of 2017. So of this, there are 87 new commitments that were made in 2017 alone, an increase of 40% within 1 year, and 77% since the global strategy was relaunched in 2015. The 2017 Family Planning Summit was an important contributor to the mobilization of these new commitments. Next slide. The global strategy successfully mobilized support from both governments and a diverse group of non-governmental stakeholders, reflecting the nature of the strategy itself. It's led by countries, but it's multi-sectoral, multi-stakeholder, and based on partnerships. The largest number of commitments to date has been from governments, which made 106 commitments, or just over 1/3 of all commitments. However, NGOs, and as we've been talking a lot about this morning, the private sector and others also made highly significant commitments. Next slide, please. The total financial commitments amount to over $35 billion. So between 2015 and 2016, there were committed about $29.3 billion. 2017, saw an increase of almost $5.8 billion on top of that. The large majority of the funding committed in 2017 was pledged at the FP 2020 Summit to improve access to family planning services. Overall, most financial commitments were made by donor governments, closely followed by low-income and middle-income countries. High-income countries pledged 42% of all financial commitments, followed closely by low-income countries and low- to middle-income countries, which together pledged 37% of all financial commitments. So there were $13.6 billion of this $35 billion in financial commitments to the global strategy, is estimated to be additional, which we all know is an important point. And much of this additional funding was committed by lower and lower middle income countries. Commitment makers are delivering on their financial commitments and are on their way to dispersing the $35 billion pledged to the EWEC Global Strategy. Of this to date, over $9 billion has been committed, dispersed. So we all know that that's the important point. The value of these commitments is they generate that political will, that sort of combined thinking within a country of capacity to deliver on what it is we're trying to build in terms of these primary healthcare systems that are high quality and highly functioning. But what's actually being spent? And that, as we know, is a big challenge. Later this year in November, FP 2020 will also be launching a report. We do an annual report, and this time, for the first time, we have disbursement data for 31 countries. But it's taken 5 years of effort between global systems like WHO and UNFPA and tracking and data systems in country to come to a number that's been vetted and agreed by all partners, including governments. And so it's not an easy thing to track beyond what we're buying in terms of commodities. What does it cost within health systems? So these numbers, while we see them growing, are very difficult to get to, they're difficult to vet, and they're difficult to show. So while we're looking at commitments today, we know we need a lot more to do on this disbursement data as well. So going forward, our efforts to mobilize additional resources for all of these needs, for women, for children, and for adolescent health will continue, but we know that much more funding is needed. I'd also like to mention that when it comes to direct funding, a number of the commitments themselves are looking at the range of issues that it needs to deliver high-quality health care. Beyond products, it's innovation, and things beyond direct financing as well. Next slide, please. From 2015 to 2017, 20% of the global strategy commitments were in support of humanitarian and fragile settings. And this is a change of perspective as well. We're in the first round of the strategy. In the first round for FP 2020 as well, it was development actors who were committing and focusing. But the humanitarian community, and we heard this compellingly from Elhadj as well, has made a compelling case for why our communities need to work together and commit together so that the vision we're building is for everyone and for health systems, political systems, and countries that are functioning for everyone. So given the 535 million children that are living in countries affected by humanitarian crises in 2017, more attention, obviously, is urgently needed. So an important part of the commitments, again, as I mentioned, came through the FP 2020 summit. So it wasn't just from humanitarian actors asking for the development community to work in partnership. It was also countries themselves that were highlighting that they work in and live in complex operating environments, and they see a holistic approach needed to reach all the people living in countries. One of the big changes as well that was announced was that the Minimum Initial Service Package, as we all know as the MISP, also announced that they were launching a new package that included for the first time a 6th pillar on unintended pregnancy. So we're still waiting for the full rollout of that and the full implementation, but we know that in looking at unintended pregnancy that we'll be realizing an important objective for many of the women and girls who are counting on us to provide a framework that will meet their needs. There was also launched a global roadmap for improving data, monitoring, and accountability for family planning and sexual and reproductive health in crisis, and that continues to roll out. Next slide, please. In 2017, the attention toward adolescents has significantly improved compared to 2015 and 2016. This focus was largely driven again by FP 2020 commitments. There were many more commitments related to the reductions in the adolescent mortality rate and the adolescent birth rate in 2017. A recent study by Shihi Lee and colleagues finds that development assistance for adolescent health increased approximately 5-fold from just around $110 million in 2003 to $528 million in 2015. However, this development assistance for adolescents remains only a small portion of the total development assistance for health, just 2.2% in 2015. Although adolescents have been prioritized in EWEC's global strategy and make up an increasingly large share of the global population, these findings suggest that more work is needed to prioritize adolescents by donor agendas. Another recent study from Chun-Ling Lee at Harvard found that the coverage for 4 more antenatal clinic visits for coverage in Vietnam in 2002 was 31% for non-adolescents and around 30% for adolescent mothers. However, in 2013, the coverage for these same antenatal clinic visits increased by 44% for non-adolescent mothers and only 23% for adolescents. The inequality between the two groups grew from just below 1% now to more than 23%. And that's an inequality measure of 23% in growth. This suggests that non-adolescent mothers benefited more than adolescent mothers from the programs for promoting antenatal care in Vietnam. The improvements in antenatal care have not necessarily passed on to younger mothers in the same way as they have for others. Further, development assistance for adolescents does not match the burden of disease among adolescents. Sexual and reproductive health and HIV/AIDS investments accounted for about 68% of the total spent for adolescents between 2003 and 2015. But as we saw earlier, other leading causes of adolescent mortality and morbidity, such as road and traffic accidents, depressive disorders, including, as we saw, self-harm, and iron deficiency anemia, received little to no development assistance at all. Next slide, please. The commitment report also analyzed progress on the implementation of commitments based on the results of an online survey, which was sent to 176 non-governmental commitment makers. Of these 176 commitment makers, 60%, or 105 in total, reported to the survey. It's important that the overall progress is much higher than the survey reflects because it was not sent to all commitment makers and it was not completed by all that had the opportunity to complete it. These 105 non-governmental commitment makers reported that they reached 146 million people through service delivery activities across the 6 focus areas of EWEC's Partners Framework since the launch of the global strategy in September 2015. 3/4, or 74%, of the 146 million people reached with early childhood development services, the EWEC focus area highlighted by the 2018 H6 monitoring report. In addition, 13% of people reached were through services related to sexual and reproductive health and rights, 9% through services related to adolescent and young adult health and well-being, and 3% through services related to advancing quality, equity, and dignity in services. Commitment makers reported reaching fewer people through services dedicated to empowerment of women, girls, and communities, and to humanitarian and fragile settings. In addition to the 146 million people reached with services, 377 million women, children, and adolescents were reached through EWEC's commitments that used digital platforms such as e-learning and mobile health platforms, thus reaching populations indirectly rather than through direct service provision. So obviously tracking that outcome will be a challenge for all of us going forward. So last slide, please. So relevant conclusions from this report. Again, it analyzed the current situation in relation to commitments made to advance the global strategy, and it included all commitments made between September 2015 and December 2017. Overall, the report showed significant progress, but also points to important areas requiring additional focus. The EWEC Global Strategy continues to catalyze unprecedented support for the health of women, children, and adolescents, and commitment makers are delivering on their financial commitments and are on the way to dispersing this $35 billion pledged, but much more needs to be done. The online survey also shows that commitment makers are implementing very significant delivery systems commitments, And again, we're working as a community to sharpen our ability to measure what those disbursements actually are and what the impact of the disbursements will be. The report again highlights that substantial additional funding is needed to achieve the health-related SDG targets. At the same time, the stagnation of development assistance for health has been mirrored by a similar plateauing of SRMCAH donor funding. Going forward, the role of technical support and political advocacy will become increasingly important to support domestic resource mobilization, which I know we all feel is incredibly important. Thank you.
All right. Otherwise, it's going to be too tall for me. It's all right. Well, thank you, Beth, and I think that's a good way to sort of start our conversation and gets us thinking a little bit about some of the challenges also in ensuring that we have the type of accountability for tracking funding and ensuring that the funding is not only getting to the right place, but actually achieving the results that it's setting out to achieve. Gavin, I'd like to start with you. You have looked a lot at investments in health and what's needed and what some of the gaps are. And so I'm hoping that you can talk to us a little bit about what some of the gaps in global and domestic financing are, and really what can be done to track the funding as it's going to potentially address some of these gaps. I mean, you were talking about how only 2% is going to adolescence, and we heard about early childhood. So not only what are those gaps, but how do you direct financing to those gaps and ensure that they're getting there?
Thank you very much. Well, as you mentioned before, I've been involved in the Lancet Commission on Investing in Health, and maybe I could just say a little bit about that commission and what it found, because I think it's useful for framing the discussions. We published a report called Global Health 2035 5 years ago now, 2013. And we showed that if we make the right investments, we could achieve a universal reduction in avertible maternal, child, and infectious disease deaths down to the sorts of levels we see today in the best performing middle-income countries. Yes, of course, it's going to take new money. We estimate around $70 billion a year to achieve this phenomenon of a grand convergence. But the health, social, and economic returns would be extraordinary. We estimate that that investment would avert 10 million deaths per year, year on year, from 2035 onwards, and that every dollar that we invest in achieving that grand convergence would return something like $9 to $20 back, which is certainly one of the most impressive returns on investment in all of global development. And those investments need to be around scaling up evidence-based interventions, the kinds of packages of interventions that are described so beautifully in the latest Disease Control Priorities project. It needs to be obviously in delivery systems, which I'm sure we're going to talk about a lot more this morning. Those interventions don't just deliver themselves. We need to strengthen our implementation. And crucially, and my own team at Duke are so tired of me talking about this, we need to develop and deploy tomorrow's tools. None of the targets that we're talking about today, certainly not grand convergence, certainly not the health-related SDGs, are achievable. It's a fantasy to think we can achieve them with today's tools alone. We're going to need tomorrow's tools as well. So that's what's on the table. Unfortunately, there are some red flags. The Commission just recently reconvened. We'll be publishing an update of our report next month, timed to the 40-year anniversary of Alma-Ata. We'll be presenting it in Kazakhstan. And we see progress stalling in a number of areas. What we've done is to look at progress over the last 5 years since our last report, and in a number of areas, particularly maternal mortality and TB, we see that at current rates of progress, we're not going to see a grand convergence for maternal mortality until 2067. So we have a lot at stake, a huge amount at stake. You asked me about some of the challenges and some of the gaps. This is a financial accountability panel, so you know the finances are top of our minds here. We are short of something like $33 billion a year for RMNACH. We have seen a stagnation in development assistance for health since the financial crisis. That is a new normal in aid for health that I think we should not accept. We shouldn't accept it's a new normal. We need to continue to make the case for increased investments in health, as, to quote Larry Summers, the mother of all development sectors. We are also seeing a depressing decline in funding for global health product development. Since 2009, there has been a steady decline. With the exception of a little bit of funding for Ebola, that research and development money is falling. We are looking to domestic resource mobilization, obviously to fill the gap as needs be, but that is moving too slowly. And the WHO just came out with a very alarming report showing that since 2000, low-income countries have become increasingly dependent on development assistance for health. So that's a very big worry. So that's on the financial side. We've heard a lot about some of the systemic issues, health systems, weakness, fragility, and certainly on the political side, this morning we've already talked about the importance of parliaments and of politics. Raj Kumar talked about how this is a political moment, and Gabriela Cuevas Barron talked about the role of parliaments. And we are seeing worldwide, in this country as well, and my other home country of Britain, we are seeing a retrenchment and a retreat from health as a domestic priority, and that is something that we're going to have to reverse. So those are some of the headwinds.
Thank you. Next, I want to go to you, Miriam. You sit at a really unique sort of intersection at the GFF, and the GFF does some really unique work with countries and with the private sector, and obviously you sit at the World Bank, and so you're sort of at this nexus of different sectors. And so I wanted to ask you, what are the expectations both from countries and from donors in meeting these financing needs? You're also at the GFF coming up to replenishment, so I know that you're probably thinking a lot about how to both play the political aspect of things, but also make the case, the business case, and that's something you help countries create. And so what are the expectations from countries and donors, and what sort of systems need to be in place to then hold them accountable for these commitments that they make?
Thanks a lot, Adva. And clearly we are in a situation where we need commitments. We need commitment to invest in people. And I think, the scenario that Gavin outlined of huge financing gap, at the same time as we have made very little progress on the SDGs. We need to accelerate progress now. Countries need to accelerate progress today in order to achieve the SDGs. So what can we do, as you asked, Advan, in this scenario with most likely flat continuation in terms of ODA trends? So where is the money that could make a difference, and how can we make better use of the money we have? And that's really what we're trying to figure out. And I must say, we need commitment of all the stakeholders in this room, first and foremost, everybody. Governments need to stick to the commitment to priorities to tackle the tough health systems challenges, priorities that others have talked about today across the continuum, the life cycle, pre-birth, birth, early years, and adolescence, because that's really where the future lies. That's the huge opportunity and potential. And it's very hard to stick to priorities, as Nono so well described. So how do one stick to priorities, and how can governments actually start to mobilize those domestic resources for health and development? And also align the rest of the donors. Donors, of course, need to start to be aligned with those country priorities to really support the national investment case and align to that and help mobilize the resources that it takes. Development banks, like the World Bank, needs to provide that concessional financing in support of these priorities. And as you well know, concessional financing, money coming from banks, are the country's money. So how can that be best used in support of investing in people? And the private investors, how do we attract them through really a strong results-based focus and accountability? We have all these elements at hand right now. That's why the UN Secretary General and the World Bank's president 3 years ago created the GFF, a new financing mechanism, to support countries to really amplify and mobilize those resources for that investment case. Now, commitments has to go hand in hand with accountability, and of course, civil society play a big role there. But we need to get better in the kind of indicators we put forward. We have great programmatic indicators, coverage, outcomes, but about finance indicators. And I think we have to all ask questions like, are countries raising domestic resources, and where do those go to? Do they go to health? If in the health budget, does the money go to primary health care? What's the share of primary health care, community health of countries' health budgets? And really start to ask those questions around where the money goes. And clearly we have a job to do to get better tracking, and Beth talked about the importance of tracking and how hard that is. National health accounts, public expenditure reviews, simpler tools so that we can all do better in that regard. Thanks.
Thanks, Miriam. We've heard a lot about the private sector this morning so far, and I think one of the things that Chanel said earlier that was very true is that the relationship is changing and the way that companies engaging is beginning to change. And it's certainly something I've seen even over the last 5 years, that we're starting to see a different sort of engagement. It used to be much more about public-private partnership and big announcements that often were for sort of brand gain and things of that sort, and we didn't necessarily see the end, or sometimes the commitments weren't delivered on. And so I think we are entering a different era, but it's important obviously to hold the private sector to account. But I wanted to hear from you, Marianne, about what you see as the role of the private sector in catalyzing this finance, how at Merck you are tracking your financial commitments and ensuring that you're following through on them and they're achieving the objectives that you set out to achieve, and how other actors in the system, how country investment plans can help Merck figure out what are the best places for us to invest alongside with the government, and sort of what you need as a company to best invest in health and figure out where you're most aligned.
Great. Thank you so much, Alda, for the question. And also thank you for all the previous speakers. I think we've all heard that we are not going to get to the SDG goals without the critical partnership of the private sector, and a partnership that is based on trust. This panel is about financial accountability. I would posit to everyone that when we talk about financial accountability, it really is a mutual accountability, and many of the things that we talk about as applying to private sector really apply across the board, whether it be governments or international agencies or even civil society. I also want to talk about the fact that I think Raj, you talked, where's Raj? Hiding somewhere. I caught him. So he talked about speaking with the Secretary General and hearing this sense of urgency. I think if we're actually to step up and meet the sense of urgency, we need to refocus the conversation on accountability away from the transaction and towards the results. And looking at results as shared healthcare value that's sustainable, so that it can meet not just today's needs, but tomorrow's needs that we may not know about. And not only the value when we're talking about increased population health outcomes. And I do think that when we refocus that conversation around accountability to those outcomes and that shared value all of us can create, we really can work together to solve for the problems. Alda, you also talked about how is it that we want to do this better? Yeah, how is it that we actually get there faster? And I think there are two things that I wanted to put on the table today. The first is we really need to figure out what that enabling environment is to crowd in private sector investment. We've worked with the GFF, and I think it's a great example of how we need vehicles and platforms to reduce those transaction costs that currently exist for private sector to contribute in meaningful ways and also to scale up their contributions towards these SDGs. The other point I wanted to put on the table, and this comes back to that concept of trust. To develop trust and to speak to each other in ways that we understand each other, we need to have a shared lexicon and we need to have shared metrics. when we look at the metrics, we need to look at return on investment, not just, again, from the private sector from a financial perspective, but also from a social impact perspective. And so what are those metrics that all of us share and all of us can speak to and all of us can actually track ourselves against that include both social impact and financial return on investment? Because unless we do have a financial return on investment, none of these commitments are sustainable for the long term. And we are not going to have the resources to actually invest in the research and development that we need to develop tomorrow's tools. And we're not also going to have the resources to actually scale up those innovations so that they're available for the population at large. Thank you.
Thank you, Marianne. In just a second, I'm going to go to Dr. Patricia Mupeto-Bobo, and we're really happy that you could join us. But before we do that, I want to go to our survey results before we get a government perspective. Hopefully we can... All right. Well, maybe we'll get to them right after Patricia speaks with us. So I think it's really important that we have you on this panel because I think it's critical to have a country perspective on financing, because it goes without saying that domestic resource mobilization is a critical piece of this puzzle, but also, as Mariam was saying, that if people can sort of unify around a country plan, a country investment plan around health, it helps to set priorities in a way that are in line, not only hopefully with what the government wants, but with what citizens are asking for and demanding and what their needs are. And so I wanted to ask you about the work that the Zambian government is doing on domestic resource mobilization for these issues. Where do your efforts stand? What are the challenges that you are facing that perhaps people in this room can help you to address? And how are you measuring your progress in sort of both mobilizing resources but achieving the types of goals that you're setting and tracking this financing?
Thank you very much, and good morning, everyone. I think first and foremost, I just wanted to say that the Ministry of Health, in the quest to transform, has set up some goals within which to measure its progress, and we call them the legacy goals. And I just wanted to say that women's, children's, and adolescents' health has actually been prioritized, and it's actually the strategic goal number 1. So to us, that's something that is very important. And for maternal mortality, our aim is to reduce the current rate from 369 per 100,000 live births to less than 100 per 100,000 live births. And for under 5 child mortality, currently we are at 75 per 1,000. We want to reduce that to less than 35 per 1,000 live births. And in order to strengthen adolescent health, currently we actually have a unit that is in charge of adolescent health. This wasn't the case in the past, so this is a big achievement on our part. And it's not only at national level, but it actually translates to all the various levels. And the other thing is that every time when you talk about resources, you have to make sure that you have a specific budget line for something to count. So that is now the case for adolescent health. Before that, it was actually in the wider reproductive, maternal, and child health. As a country, we are mindful of the importance of domestic funding for sustainability. And generally, Zambia's total health expenditure in absolute terms has shown a steady increase, while the overall percentages have from time to time shown some dips. For instance, between 2000 and 2013, our government health expenditure as a percentage of total health expenditure increased from 38% to 58%. And currently, in 2018, we are actually at 61%. And in terms of government expenditure to the health sector, it has increased from 8.7% in 2016 to 9.3% in 2017. and the dip in 2018 of 8.8. So we are actually about 6.2% from attaining the Abuja target. But I want to say that for a country that is still developing like Zambia, it means that as the health sector, we have to actually put up a good case in order for us to get significant amount from the national budget. And one of the things that we're trying to argue is that for a country like Zambia to develop, we need a healthy population. And so for us, investing in health is not a social investment, but it's actually a very good and smart investment. So that is the case that we've always been able to put up. And I think we've seen it bearing fruit. And apart from the traditional ways of budgeting, we actually have introduced in April this year a National Health Insurance Act. And we feel this is also going to actually add to the financial resources that we're going to have as a health sector. And also we are working on sin tax, on health and healthy beverages. Right now in Zambia, NCDs are actually responsible for about 23% of all deaths in the country. And this is a very big thing. And every time you talk about an increase in resources, you also have to be mindful of the fact that accountability comes along with that. So we have set up a number of measures, and one of them is the National Health Accounts to track resources within the health system so that we make sure that they're being used in a timely and efficient manner. And there are also other internal measures that have actually been set up, and I think so far we feel we're on track. And by 2021, we'll actually have to sit down and see how we're performing, and we actually hope we're going to reach our targets. Thank you very much.
Thank you. All right, now let's see if the survey results are in. All right, here we go. All right, so about 43% said 8 countries, 15% said 21 countries. Oh, 21% said 15 countries, sorry. 22% said 22 countries, and 35% of you got the answer right, which is that only 2 countries have met their targets under the Abuja Declaration. So there is a long way to go. So that puts some of the domestic resource mobilization challenges in perspective, and I think gives a lot of people a mission to try to figure out why we're falling short on the domestic resource mobilization targets, and how people can be helping governments to both make the case and find effective ways to raise those funds. And obviously we heard a little bit about what Zambia is doing and some of the different ways that they're looking to raise additional domestic resources. So now I want to go to you guys and open the floor for questions and comments. So we're going to take a few at a time like we did last time. And we'll start here.
All right, thank you very much. My name is Patrick Mwesije. I'm the founder and the CEO of the Uganda Youth and Adolescent Health Forum. But I also sit on the PMNCH board as an alternate board member for the Adolescent and Youth constituency. So I have 2 quick questions. One about the Global Financing Facility. My question is how do we make the GFF money work for young people? Because apparently there's a huge disparity. Evidence is clearly showing us how related maternal deaths and complications are happening more among adolescents and young people. But we've also seen GFF processes are still closed from very many players, and especially young people. For instances where young people have an opportunity to be in these spaces, they do not understand that process because it's a bit lengthy. They're talking about millions of dollars. And you have all these government representatives around the table, and the young people's voices and priorities are not yet coming out strongly. And this is something we've tried to bring out even through the CSO coordinating group, but we feel it's not yet much addressed. And we want, I would really love to hear from you, and also to understand some bit of like practical ways, not only at global level, because we don't think impact will be made at global level, but at country level. And two is about family planning resources. Yeah, we have, over time, we are seeing increasing, especially in the last few years, 3, 4, 5 years, we've seen increased growing amounts of resources to family planning. And this has actually resulted into availability of supplies and commodities. But unfortunately, we are caught in a paradox where those who directly need, the women and girls who need to utilize these supplies and commodities are actually not utilizing them, even when they are available. Actually, would love to see even data on what goes to waste, because we know, like where I come from in Uganda, we've seen the National Drug Authority announcing every year supplies worth millions of dollars going to waste and being destroyed, you know. And we know the reasons. We know things like age of consent protect very many adolescent girls from accessing these services, culture, and negative cultures, values, and traditions and all that, stigma, poor health work attitudes and all that. So I just want to know, how do we, and this goes back to Beth, I think, and her team, how do we support more, how do we support young people to hold governments accountable? How do we see young people taking on accountability initiatives to say, it's not only enough to invest and have these supplies available, but what is more important is opening up doors to make sure that young people are utilizing these supplies.
Great, thank you. Do we have any questions from the internet?
There was actually a question about the poll results and if they could know what the two countries were.
Ooh, does anyone on the panel know the answer to that? Someone in the room must. All right, so we're gonna go, we have one question here and one question here.
Good morning. My name is Meeta, and I represent the What Women Want campaign, which started from India and has now become global. In India, what we do is we are trying to get women's voices heard in the decision-making forums. And when we talk about health, women's health and maternal health, there is lack of space, such spaces where women's voice can become evidence to guide planning processes. So one such effort we have done in India is collected voices of almost 1.5 million women and taken these voices to the local governments, to the elected representatives, to the state and national level ministers, and we are getting their voices heard. The challenge is there's very limited resource available for such sort of work. I mean, the large chunk of money goes to services, which is important. But to empower women, to build capacities of women to articulate their wants is a gap in funding. And I think when we are talking about accountability, we need to have more such forums where governments and donors become accountable to the right holders, the women themselves.
Great. And we're going to go right here.
Thank you. I still feel that we are in the mindset of thinking about donors and international resources. And I think we need to just take in reality. 76% of resources in low-income countries are coming from domestic resources. 95% in lower middle-income countries are coming from domestic resources. So, I mean, just let us wake up. It's not about donors. It's not about international money any longer. Countries are doing great. First point. Second point, in that spirit, when we speak about that, governments should mobilize resources. I have a little bit of a problem with that, resource mobilization. Governments don't do that. I mean, what governments are doing is creating a system, a society where you can actually generate enough resources. And what is most important here are actually generating taxes. And that's an important role for the private sector. We need the private sector that actually pay tax. We need to ensure people get a job so that they don't need to pay out of pocket. They need to get a job in a company that pay taxes so that you get revenues to the government. Then you can also have private insurances that are complementary to this. But I think this sort of, we are still in the old mindset here, mobilizing resources for something, a new global fund or something. The government needs to mobilize resources. Yes, you can have a tobacco tax, but that is minor when it comes to total financing in countries. So I think we need to shift our thinking here, begin to wake up in some way. And then what comes with that is, of course, then the accountability. And that is part of democracy, that people in countries need to hold the governments accountable for what priorities they are making and what resources they are putting where, and even more importantly, not just whether they are putting the money in the right, putting the total amount there, but what results are we actually achieving. We have quite a few countries where, if you look into the entire world, that spend quite a lot with quite poor health outcomes. So let's not just focusing on the amount, but also the actual health outcomes. But most importantly, let's try to get away from, I mean, we're looking for more resources and we're looking for more health results. But let's take in reality what reality looks like today. Thank you.
Okay, perfect. We'll take this one last question and go back to the panel.
Thank you so much. My name is Machel Farmer. I'm from NCD Child and the American Academy of Pediatrics. I really want to follow up on the previous comment that was just made, that I'm concerned that we are not looking beyond SDG 3 to look at implications of health. When we consider the important impact of environmental issues and the role that the private sector can play and should play to rectify some of these antecedents of chronic diseases, such as respiratory diseases, intestinal disorders, and we're not, I think, broadening our net of accountability that includes the private sector as effective change agents in some of the underlying antecedents that are causing some of these problems that affect not only the health of children and adolescents, but it has a direct impact on maternal health and morbidity and mortality. It may have a direct effect on neonatal deaths and stillbirths. And we're not, I think, making sure that we are holding private sector accountable and make sure that our goals and targets are set that acknowledge those issues. Thank you.
Thank you. All right, we'll go back to the panel, and unfortunately, I'm not sure we're going to have time for another round of questions, but Miriam, maybe we'll start with you and the question about youth and how they can engage with the GFF, and then if others want to sort of respond, maybe Beth, you want to respond as well to the question about youth.
Thank you, and I really appreciate what you said about youth voices, that it's not just about youth voices at the global arena, but it's really in countries, because of course we have youth representation in our investors group, but your point is very well taken. Now I would add an element to what you say. Youth voices are critical. What's also critical is to ensure that the financing we're talking about go towards adolescents empowerment, their health and education. And there I think as countries shape those investments in adolescents to make sure, nothing about us without us. And I think there being able to actually draw from some of the good practices and learn across countries from, for example, in Mozambique, the adolescent reproductive health component and the engagement of youth in that, and see how we, as you suggest, really can walk the talk in all countries that are engaged in the GFF. So thank you for that. I think we have started, but we can do much more, in particular to build capacity among youth to be actively and meaningfully engaged. So thank you for that comment. I really welcome Anders' comments. Thank you. It really is about shifting the dialogue about financing from as an old-fashioned donor-recipient modus operandi to where we are today. And I think the experience we have now from 3 years with the GFF is exactly what you said, that with really small, modest amount, if you put your emphasis on mobilizing the domestic resources, really make the private sector trust, the mutual trust, crowd in, create an enabling environment where private sector investors feel comfortable putting their money in as well as the government money, we are in a whole different scenario. Why I am optimistic is to see a country like Cameroon decide to shift its investments in primary healthcare from 6 to 22%. To finally see Nigeria, who has debated using domestic resources for their basic package, making that decision this year, to provide new additional domestic resources towards a basic package of services across the continuum. And what really I think is encouraging for all partners in seeing an increasing amount of countries' governments actually being committed to linking disbursements with indicators like keeping your domestic your budget allocation for health, that you don't shift your budget allocation for health with new inflows of money. Those kinds of very important decisions is really encouraging today. Thanks.
So, yeah, maybe we'll go to you, Marianne.
I know there have been a lot of private sector questions, so I'll take a couple. But first, I actually wanted to respond to the question about women's voices. And this, I think, if we broaden the conversation around private sector to look at total healthcare markets and how women and consumers are an important part of that market, it's not just about the base is we have to listen to women. But we need to do more than that. We need to, as you said, make sure that their needs and wants and voices are integrated into policy. But I actually believe the most powerful and probably the most sustainable way that women's wants and needs get actually integrated into the way we deliver care is when they're able to demand quality and use their purchasing power to vote with their dollar. And again, that comes back to how do we create that total market where all actors are accountable to each other, making sure that everyone understands what quality is and can make decisions based on quality. I also want to respond to some of the broader questions around private sector accountability. I do think, as Miriam says, there are good examples of good private-public partnerships that are doing what it is that we all want them to do. We need to actually share those examples and learn from them, figure out how to replicate them in multiple markets, and then we can have, I think, a discussion about the positive contributions of private sector to meeting SDG goals. We need to surface what works and rally and mobilize around what works. Thank you.
Thank you. Beth, I don't know if you wanted to jump in and talk about any of those issues, or perhaps the question about how young people can help hold governments to account.
I'd be happy to, and thank you, Patrick, for raising the question, as you always do, and putting a challenge to this room and to all of us, that we not only open the doors for meaningful engagement with young people, but that we also empower them to participate in these discussions in a way that can move things forward. When we're working with countries, one of the things we always do is share or open up a data learning session so that as we're pointing young people to where resources are around government commitments, around annual tracking of what's happening in countries, both with EWEC and with FP in particular, we're also working with them to make sure that they can use that data for advocacy. And the point that was raised around, that we're focusing often on supply chains, on making sure that services are in place, aren't enough. That if we don't empower people to interrogate their systems and to know what they can ask for and what governments have committed for, then we're missing a big chunk in between what's available and what can happen. So I agree, we need to work a lot more to ensure that the door is open and that women and young people are able to use those resources in order to push and to advocate for themselves and their personal needs. And then I want to go back to the point that you also raised, Patrick, about underutilized commodities that are available. And the question I would ask all of us is, have we provided the kind of healthcare for women where they understand their needs, they understand the options, and that those options are available? And going back to your really important point about primary healthcare, it's the integration of services so that women can present all of their needs and have a doctor or a healthcare worker help them navigate that. I wonder what's being tossed away. If a woman needs emergency contraception and she's offered a condom, we're not meeting her needs. If a woman can't use or doesn't want to use hormonal contraception, if we're not offering her an option that's going to work for her body, then whatever's on the shelf in that healthcare unit is not going to meet her needs. So if we're not understanding women's needs, if we're not giving them an opportunity to express that, and we're not shaping healthcare systems that integrate services so that she can make a decision for herself, then we're missing a big point. I think we've taken incredible steps toward that, but there's so much work that needs to be done. And this holistic approach of thinking about sort of universal aspirations through primary healthcare systems is the way forward, because it's going to provide a woman an opportunity, a young person an opportunity to understand all of those options and then to provide the services to meet those needs.
Thanks, Beth. And we're just going to do a couple quick closing comments. Gavin, I can go to you next, and you can respond to some of those questions.
A couple of things. Firstly, on financing, I mean, Anders is absolutely right. You can only achieve universal health coverage through public financing, and it's very trendy to talk about innovative financing, but there isn't any. It's called taxation. That's innovative. All the other things are really just tinkering at the margins. Now, that's true for stacks, sugar, tobacco, and alcohol taxes. However, they have an incredibly important public health role. We know that. And that's one way of countering, let's face it, the sometimes malign impact of industry in pushing forward the commercial determinants of health. I don't know if you saw that extraordinary piece in the New York Times about Nestle in Brazil training women to go out to favelas to peddle, appalling, highly processed, high-fat, high-sugar, high-calorie food. And we just need to call out those sorts of practices when they happen. And around UHC and domestic financing, we know that there will be enough money in the system. This is about political prioritization. The Commission on Investing in Health estimated that grand convergence could be achieved if countries, low and middle income countries, were to dedicate about 3% of their economic growth over the next 20 years to that agenda. So that's about prioritization, it's about reallocation. There are many countries that are spending more subsidizing fossil fuels than they are spending on health and education combined. So there's a reallocation agenda. They're not taxing multinational corporations sufficiently. And maybe I should stop there.
Thanks,
because I'm starting to sound quite strident.
So I think following up on that, I'll go to you, Patricia. And you mentioned some of the efforts that you're making. You did mention that this year you've seen a bit of a dip in the percentage of the overall budget that's gone to health. What are the challenges that you're facing in terms of making the case for health in the overall budget? How do you push that conversation forward? How do you ensure that, you talked about introducing a sin tax, which I would imagine would go directly to funding some health initiatives. But talk to us a little bit and maybe respond a little bit to what Gavin was saying about sort of the government responsibility for financing these things in the appropriate way.
Thank you very much. I think I actually just wanted to say that one of our role as a health sector is to make other sectors responsible for the health, and to know that they also impact a lot on health, as actually came out. So in Zambia, we actually managed to make government accept the health in all policies strategy, and we feel that with time, the other sectors will come on board and actually take up responsibility of how they also play a role in the health of the nation. And the other thing I wanted to say is that generally we talk about ministries of health, but most of the times I think we are actually ministries of disease, because we are on the receiving end. A lot of other things are done by other sectors, and the health sector actually has to sort of mop and clean. But I think it would be good to actually move from that. And as long as sectors accept that they also have the different sectors also accept that they have a role to play, then every time, the health sector will actually get a bigger share of the budget, because then the case is going to be that even though the money doesn't go straight to the health sector, the other sectors will indirectly make sure that the health of the population is taken care of. Thank you.
Great. Miriam, do you want?
I think we are sort of talking about additionality now, and additionality coming both from domestic resources, but let me just say we can't forget one thing when we talk about domestic resources or any resources, and that is efficiencies. Reducing inefficiencies is probably one of the hugest gains. So I just wanted to add that to the conversation here, and clearly it's both about the domestic resources but also the private sector flow, foreign direct investments, remittances, and that's the two areas we need to cap and not forget the value for the money that we raise. And again, on taxes, again, what makes me optimistic is that we are able to work with countries on that. The reason the GFF can do it is because we are, housed at the bank and can tap into the IMF, because these are bigger macro conversations. So the fact that DRC is working to raise resources from tobacco and Liberia from alcohol, these are important lessons that we can all learn from. So thanks.
Great. Well, please join me in thanking this wonderful panel. And it's my pleasure now to introduce my colleague, Helen Morgan, who's Associate Editor for Partnerships at DevEx. And she's going to lead a really important conversation that I think will sort of pick up on how we hold governments and others to account for some of these things, which is about social and political accountability. Thanks, Helen.
Thank you, Adva, for that introduction. And thanks to all the panelists as well for such an interesting conversation, and to the panelists before that last session as well. It's certainly been an interesting morning. Thanks to everyone for staying through to the end. And I promise that we have a very interesting and dynamic discussion on its way. So we are starting a little bit behind schedule, so I'll keep this very short. We all know now why we're here and why this topic is important. And I'm going to just invite the speakers to the stage already, actually. So we are joined today by Ayushmita Hazarika, Coordinator Resource Mobilization YP Foundation India, Thais Boema, Director of Countdown to 2030 Reproductive, Maternal and Newborn Child and Adolescent Health, Dr. Nana Bali Chidi, President of White Ribbon Alliance, Nigeria, and Jonathan Katz, author and journalist, Director of the Media and Journalism Initiative at Duke University. So, as you all know, we'll be talking about social and political accountability. And so many interesting and important topics are going to come up over the next 30 to 40 minutes. But just briefly, we have one final poll. So I think it's already on the screen. So among the voting age population worldwide, what % are between the ages of 20 to 39? So everyone can vote on their phones. So number 1 is 10%, 2 is 26%, 3, 49%, 4, 67%, and number 5 is 75%. And I will reveal the answer in just a little while. I've actually got kind of breaking news from the previous poll that those two countries, so this is to answer the person who asked this at home, those two countries from the previous poll were Madagascar and Sudan. So I don't know how many people knew that. So I'm now... Rwanda and South Africa. Oh, okay. I was told. Forgive. We have some conflicting information. So while we discuss that, I'm going to hand the floor over to Ayushmita for our first Spark Talk now. Thank you.
Thank you, Helen. I think that made us all awake, just in start for the final panel of the day. Good morning, everyone. It is a pleasure to be present here amongst you all today. I will be honest, it is inspiring, humbling, but also daunting to represent the youth constituency, when in reality, young people are diverse in their representation, intersectional in their articulation, and occupy a varied array of spaces. But sometimes spaces can be ironic by the virtue of where they are and who can access them. For example, I recently came across an event titled Inclusion and Diversity, but the attendance to the event was through an invitation only. We claim to be in a world where spaces are inclusive and diverse and representative of young people, but sometimes it's the opposite of that. But what happens when young people are left behind from these spaces? We leave their lived realities and personal articulation from the conversation. As citizens, we're aspiring more freedom and accountability, but are stopping short in understanding ways where young people can become decision makers and movement builders. There is a need for serious and sharp conversations to be had instead of pedantic and condescending ones. Intergenerational dialogue needs to happen not just in UN spaces, but out in the streets, in school environment, across communities, in refugee camps. So why then are dialogues on decision-making processes not inclusive of young people? Whose responsibility is it to make sure that platforms and processes are geared to ensure that conversations take place on the terms of a young person, instead of talking in a language that is more familiar to policymakers? We need to work at both ends, that is, policymakers and young people, to create panic, at least among one decision maker, when we are talking about adolescent health. We need to connect young people with policymakers as they emerge as champions to strengthen their advocacy towards sexual and reproductive health and rights. And when they emerge as champions, they're able to raise questions, such as a 16-year-old girl in Delhi questioning why politicians and VIPs are given security and safety, but the same safety is not provided to the girls in her community. A group of girls in Rajasthan asking the director of the health department in their district as to why they have to pay ₹8 for a sanitary pad when the menstrual health scheme mandates it to be given free of cost. 1.9 million young people are using social media to drive data and build demands for the need of comprehensive sexuality education across the country. These are some of the initiatives that we take as young people to raise our demands. As part of a youth-led organizations, we work in the areas of gender and health to develop young people's leadership through direct programming experience. In doing so, we create equal conversations with policymakers on why young people should have a role in deciding policies and not just be a part of implementing them. Co-creating of discourse together on policy inclusion and social accountability will ensure that they don't only remain a high-level critique, but are also action-oriented recommendations in order to A, create an enabling environment, such as creation of safe spaces, to ensure voices and representation is inclusive, regardless of gender, caste, class, and ethnic backgrounds. We build relationships and foster dialogue with young people's parents, community stakeholders, and key members, and encourage and engage with government officials and policymakers to present demands raised for on ground to bolster democratic processes. What happens when we ensure that these recommendations are taken on board? Definitely not what's happening on this slide. We go back to the cycle. We're able to get streetlights and public services repaired in low-resource communities to ensure safety for young girls. We build spaces to advocate with high-ranking government officials to ensure youth-led monitoring of their health programs. If we see this happening in our local context, then imagine what else could be possible when young people are present across these platforms, holding each level accountable. Although we recognize that young people are additionally marginalized, as it puts us into silos due to our age, we also need to believe in young people's energy and power to be change makers today. Having said that, the onus is not only on young people to become global advocates, but also on policymakers to frequent spaces where conversations around adolescent health are being held. Only a 360-degree mutual understanding approach will ensure to bridge a gap in order to make social accountability more responsible. We need to move towards a system of sharing power, to give up space and decision-making authority for young people to be engaged in these processes. And if this happens, think of the possibilities and the kind of world we will be in today. With youth as a cross-cutting theme across the Sustainable Development Goals, leveraging that power will create a world built for young people, not tomorrow, but today. Thank you.
Thank you, Ayushmita, and such an important point about young people building the kind of future for tomorrow and being the people who are actually holding everyone to account. So I'd like to ask this first question to Thai. So talking about data and evidence for social accountability. So from your experience as director of Countdown to 2030, how can data be used for action and to really have measurable impact, obviously particularly in terms of maternal and child and adolescent health?
Okay, thank you. So if we think back 15 years ago when the MDGs had not yet taken off, a small group of academics, civil society, and UN staff sat together and agreed to work together to make evidence-based noise, initially focused on child survival. The countdown for 2015 for maternal child survival was born and joined many other movements and partnerships that aim to make evidence-based noise about the MDGs. It led to more money, better investments, and spectacular results, especially on child survival. And data played really an important role in that, tracking global and country progress in a comparable manner, almost competitive, led to debate among countries, provided civil society with ammunition, and made donors happy. Then comes 2015. The SDGs are born, a much bigger agenda for all countries. Survive becomes survive, thrive, transform. We need to know so much more about violence, mental health, adolescence, quality of care, ECD, and so on. We need to know so much more because of leaving no one behind. We need to disaggregate data to know and target who is left behind. So for us, working largely in the supply of data, that sounds like a clarion call to produce more data. But until today, it seems to have largely led to an epidemic of global estimates and not serious investments in countries on knowing who's been left behind, generating actionable information. We also need to ask ourselves how much data is enough for action and accountability. We know that the number of commitments, we saw hundreds of them, far exceed serious efforts to follow up and monitor those commitments. That needs to change. We also know that we still need to fight ignorance with good, compelling data and effective communication. But we know that we cannot simply overcome lack of action in response to evidence by simply producing more numbers. We need much more emphasis on all having sound accountability mechanisms. And if you think about countries, that means strong public health institutions that are involved in monitoring. It means transparent, inclusive review mechanisms that involve all actors, whether it's parliamentarians or civil society, media. So at the countdown, we realized we must continue to make evidence-based noise. And we're now joined with the NCD countdown. Nice name, Majid. With emphasis on equity in the coverage of quality services. Global tracking remains important, but much greater direct collaboration with countries and country institutions should be the priority.
Thank you. Nana, I wanted to ask you, so from your experience and perspective as president of WRA in public health and in citizen-led initiatives, what does accountability look like in Nigeria?
Thank you very much for this opportunity and the platform. White Ribbon Alliance has an approach that has worked and is working for us in Nigeria and in the states where we've worked. I know that this morning we've spoken a lot about accountability, and we have very wide definitions and priorities of accountability. But I want to draw your attention to the accountability that's worked, the accountability that is the missing link, and hopefully will be the piece that we're looking for to seal up this discussion on accountability. In Niger State and through the approaches we've worked with engaged citizens, and the citizens are the beneficiaries of the systems, the health system that is positioned to provide quality for the woman, to ensure that it's responsive to the needs of the woman, and to ensure that it is delivering for the woman. And therefore, through the White Ribbon engagement in Niger State, we worked in 3 local governments. I'd like to share these experiences because this is the evidence that we need. It's the missing evidence, the voices of women, the voices of girls, the voices of youth in our communities where we've worked. When we sit at such fora and we work with public policymakers and we have the opportunity to decide and design programs, what happens when we get to the grassroots is that there's always that missing link. And we need to begin to join the dots and ensure that we hit it on spot to deliver for the most vulnerable and for the most disadvantaged women. In Niger State, through our programs, of course, like most governments, there were suspicions, and of course, it wasn't an easy sale to start the project. But we did navigate the political environment through our advocacy, our community dialogue, and ensured that we were able to convince the government that it was a win-win situation for both government and for the citizens and for the women within the community. We have worked in 3 local governments, specifically La Pai local government, Wusishi, and Chen local government. And what we've done essentially is have community dialogues, town hall meetings. At such meetings, we have the women representatives, the leaders, the youth group, the politicians, the Commissioner for Health, and on some occasions, the governor was represented by the deputy governor. And what was key is that often the politicians are willing because they do want to get the votes of the citizens. But sometimes they really do not really prioritize effectively. I can give a real example. The governor had renovated a health center. He had equipped the health center, but the bureaucrats felt we needed the governor to commission this health center. And so it was not being utilized pending when the governor would have the time to commission. But of course, we know that our politicians are very busy people and they need to prioritize and have a lot of activities. So for 1 whole year, it was not commissioned. And when they had this community meetings, at such fora, it was an opportunity because the facility that was available was not being utilized, and the women did not think it was good enough because it was deplorable and the quality of service was appalling. But what happened at this meeting is that the women's voices about the need for quality service and the need to use this facility that was under lock and key was very well expressed. This caught the deputy governor's attention, who reported to the governor, and immediately, without commissioning the facility, it was made available for the women. This is responsive, it's quick and on board. However, if you look back and think about the 1 year and the death and the poor quality that would have been averted if only we had done the right things by engagement. The governor had good intentions. He had good reason to want to do this to ensure that women get quality care. Through our engagements, increasingly, they've increased the popularity. We have redeployment of health workers because there were facilities where health workers were posted and they wouldn't show up. Getting this kind of feedback was very, very, very good and effective in terms of improving the quality of care. It breathed confidence, trust. It improved the utilizations of services. What other data do you need? It's simple. There's a before and after. The data is there. So when we listen to the voices of women, we can pick up the data and we can ensure that the results are seen. The governor was excited and wanted it to scale up. And he has put in a mechanism in place to ensure that through the World Health Development Committees, that they're not just there, but they're very proactive and engaging with the citizens. It's something that they've realized that as politicians, if they win with the people, they would win and they would provide good governance. At this time, I want to commend the good work of our governor of Niger State in supporting and ensuring that all that the women had identified were responded to. When it had to do with equipping facilities, he equipped 10 new primary health care facilities based on needs that were identified through this community dialogue and town hall meetings. And this is something that has worked, and this is something that is beneficial to all, and this is the missing puzzle. This is the missing last piece of that puzzle that needs to tie up everything so that we can bridge the gap, because the gap is huge, and we need to take it on and make sure that we bridge that gap and ensure that healthcare that we want to deliver, it's delivering for the women and ensuring that women have the right to safe pregnancy before, during, and after. They have their rights, and their rights are being met. Thank you very much.
Thank you. So we've heard about data and evidence, citizen-led initiatives, and now onto the role of the media. And so, Jonathan, journalists are facing increasing challenges in holding institutions and politicians accountable. From your perspective and experience, what's the role of journalists in media and media in accountability?
Hello. Oh, hey. All right, thank you for that question. Yeah. That's a very good question. So the media is an incredibly blunt instrument. Not all of us individually are blunt, some of us are, but our job is to go around and figure out what's going on, and if there are crimes being committed, to uncover them, if politicians are not doing what they promised to do, or frankly, if they are doing what they promised to do, to go and investigate and dig things up and present that to the public. I think the role of that in promoting accountability is fairly self-evident, but the effects are very, very hard to predict. I mean, all we can really do is dig up information and present it as fairly as we can, and then things happen that are usually completely beyond our control, at which point we then write a story about those. So, I think that, you bring up, you use the word challenge. I would use some other words about the current situation of journalists, especially in this country. That might be a bit stronger, but we can use some of those maybe after in the hallway. It's really, really difficult right now, because the honest truth is that people in power do not want to be held accountable. They will do anything possible to not be held accountable. There's been a lot of discussion in this room and some of the very interesting presentations that have happened so far about sort of vague language about the role of the private sector, about the role of politicians and parliamentarians. But of course, we all know, and a lot of us in here I think have experienced directly, that it's not just whether you can get the private sector on board to like help with your nice program, but the private sector also does direct and terrible harm to billions of people in the world constantly. And they do it gladly because they make money off of it. And when we want to dig up information about that and point it out, they don't like that because that will keep them from making money, which is quite difficult. The same thing is true with people who hold political power. And the reason why the media is under attack in this country from our leaders is because they would like to have power, and they would like to be able to profit from their own crimes and all the other things that they're doing, and they don't want people to find out about it because they're afraid that if people find out about it, they won't be able to do it anymore. And so it's in their interest to try to discredit us as much as possible. And so I guess if I'm putting in a plug for anything here, it's to understand that we are not always friends. The media is not always on everybody's same team in terms of achieving any specific narrow goal or achieving some kind of specific program. But if your goal is for truth to be known, if your goal is for power to be in the hands of people and for them to have the information that they need to make decisions that govern their own lives, then ultimately we are on the same team, even if that means occasionally having a bit of friction when we dig things up that you don't want us to present to other people. If, on the other hand, you're like some of the leaders in this country who don't want that, they don't want people to be informed, they don't want people to have power, they don't want people to have truth in their hands, then I can completely understand why you just wouldn't like us at all and wouldn't want us to help us in any way. So anyway, if you're in the former camp, I would just say, respond to our emails.
Thank you. That's a great final takeaway. So I want to make sure that we have time to take questions from the floor as well. So we are going to pull up the poll results on the screen now. So I'll try to see what these were. So that 3% said that it was 10% the voting age population that are between the ages of 20 to 39. 5% said 26%. 37% said 49%. 42% said 67%, and 13% said 75%. So we would, as a room and at home, nearly there. The correct answer is number 3, 49%, which demonstrates, I think, just how important it is to also engage this age group in ensuring that people actually go to vote. So I think there are some microphones going around. We can take some questions from maybe this side first. There are a lot. Is there a mic? Perhaps on this table here? And please, if you can just say who your question's directed to and introduce yourself, and as always, try to keep the question as a question and fairly short.
Yeah.
Thank you.
Thank you. I'm Aparna. I am a youth accountability advocate with Restless Development. Thank you for providing me an opportunity to be here as a young person. Here the talks are all around young people, but it is a very sad scenario to see among the panel or the audience. We have very less young people, so I'm glad that I'm here. We have well spoken about recognition of voices of young people, capacity building. Patrick has spoken about it. But then what about livelihoods of young people? Why young people have to volunteer when it comes to the development sector or working for social causes? I think young people would be the last generation who would want to just whine away about the governments or policies, but direct our energies towards something productive. Because we young people are more than 50% in the world who do something, who challenge ourselves to bring a change. And we have statistics to support ourselves. What do the budgets, the Mexican lady on the panel has pointed out, because budgets do the talking. So I want to ask, what do budgets do the talking for livelihood of young people? Thank you.
Hi, good morning. My name is Aaron Emmel from the American Academy of Pediatrics. In the spirit of these comments about young people, and with the new NCD Countdown 2030 report coming out, I'd like to ask about the potential to address the under 30 age of children and adolescents in reporting on NCDs. We know that traditionally WHO has looked at the ages of 30 to 70 in premature deaths from NCDs. Now that the SDG target 3.4 on NCDs no longer has that age restriction, I'm wondering what new potentials there are to finally really look at the true burden of NCDs globally, particularly because many of the risk factors and conditions of adult NCDs begin during childhood and adolescence. Thank you.
Over here, I think there's a question. If there's another microphone.
Thank you. Stefan Peterson, Chief of Health, UNICEF. The Social Good Summit is kicking off as we speak now in our overtime here. And I think it will actually make the point that we can innovate for social good. And I was particularly encouraged about your Nigerian example, Nana, about how you can bring data to bear for in the local context. But my point is the quest for data innovation in that context, because the kind of data that TEAS lives off, that upsets us in these nice breakfasts. But where it really can make a difference, I think, in addition to that here is in the local level. So just to share with you that we actually, as UNICEF, we put out a poll now to young people leading up to the Astana Primary Healthcare Conference through this U-Report platform, and we got 10 million answers, which we're busy chewing on now. And if, to the extent we can actually use innovation in the local context to solicit local data and from young people and people like you, Nana, actually to do the interface so that we save these young people actually having to confront service providers themselves, I think that's a room for innovation that we need to pursue.
Yeah, thank you very much. Thank you.
Thank you and good morning. I am Teodor Bridaru, and together with my colleagues, we are representing the International Federation of Medical Students Associations. As youth working with SDGs and for SDGs, we deeply agree with what has just been discussed. But in order to translate the SDGs into concrete action, we definitely need to go to the grassroots. And as Dr. Nordstrom just said before, it's the governments that do most of the work. You cannot just take the money from the international institutions and SDGs will happen. But for those governments to do the work, we need to keep them accountable. And who does that? Mostly is the NGOs. They are not that accountable in front of the international institutions. And we as NGOs, youth and student organizations, that's what we try to do nationally, to keep the governments and our national institutions accountable for SDGs. So for that, I pose two questions, because in order to really unleash the potential of the SDGs and of human resources and financial resources that will be free after SDGs will be solved, we still have issues. And for youth, the first issue, as Patrick said, I will just rephrase it in a more pragmatic way. How do we finance youth to really work for SDGs? Because I feel it was not very concretely answered in the previous panel. And the second question, how do we raise capacity for youth to work for SDGs? My colleagues in 2018, 3 months ago, they've never heard of SDGs. I'm from Bucharest, Romania. How do we actually educate youth to work for SDGs, because we have a big gap in that. And we don't only need organizations, we need the whole segment of youth to be aware of SDGs, to be aware of SDGs existing, and that the governments will need to work on that. So that's our final question. How do we concretely inform people, young people, about SDGs, and how do we help international organizations as we are to concretely promote the SDGs in the countries? Thank you.
Okay, I think that we'll just do a quick response session here. Who would like to begin? We have several youth-related questions, a couple of finance-related questions, which may be better for discussion following the panel. But if anyone would like to take those, please, would you like to intervene here?
Okay, I don't think I'll take the youth questions though. No, just the 2 points. One on the NCDs. I think you're absolutely right. I think we need a life course perspective on NCDs, and I think one of the best examples is rheumatic fever that eventually leads to cardiovascular death happens very early in life, and that's where the intervention needs to be. So, but I'm not speaking for WHO here anymore. So the other one, I think. Stefan's point is also a very interesting one on, how do we have the tools, the innovations at the local level to really provide the kind of data that can lead to action and so on. And I think we're still learning. It's very exciting, the U-Report platform, because we also know that social media can make an issue, but it can also break it, because, and in a very bad way. So I think we need to really learn and get stronger in using social media in a way to get that information, to have positive action. But that means also countering the kind of negative information streams that are also out there.
And Nana.
Thank you very much. Concerning the youth and adolescent, for my country, for example, the White Women Alliance is engaging young people to ensure that they get their feedback, especially the married young adolescents, to see that they prioritize, even in the dialogues, so that their needs are well articulated and attended to in terms of what they need. So we're already doing that. It's the scale at which we need to do that, more of that, and the different fora that we need to improve upon. It's basically engaging. We need to constantly recognize that we need to engage the beneficiaries, the groups that we want to target our target groups as much as possible, and that their participation in ensuring that the planning, the implementation, evaluation of the results as feedback as well, it's what will deliver the results that we need. As long as the gap is there, we continue to talk repeatedly over and over again in this same room without the results. And I know that through engagement, we're going to celebrate the success more than look at the challenges. Some of the governments, in Nigeria, for example, I've met many leaders, even the vice president when he was acting in capacity as president, when we took this campaign of accountability to say that we were here to insist that it was important to engage citizens and that there was nothing about us without us. He was really impressed because he said this was the first time he was having that perspective to healthcare, and that it was something that he would like to follow up and see the results. And he wanted a situation whereby it could be scaled up to other sectors, including education and agriculture and many other sectors, once we see the results. And we're getting the results in the states where we're working, and we're looking at more opportunities to scale up. And so an investment in citizen-led accountability, integrating it into our programs, irrespective of whether it's adolescents or whatever group, it's actually the key thing, puzzle, link, and the joining of the dots, the finalization that will produce the action. It will create the change, and it will make it happen. Thank you.
I think, oh, sorry. Yeah, go ahead. Absolutely.
I think regarding the youth-related questions, there was some addressed, because I thought that people were expecting perhaps I should answer, I should not. But I think the reason I choose not to is because I'm also in the same boat, and I also do not have the answers to the questions that was posed. And again, reiterating what I said, the onus is not on us, but also on everyone else on what can be done. And what Nana is saying in terms of partnership, the strength is in our diversity, in frequenting these spaces that we're in, and kind of presenting the evidence from on ground in these larger spaces, I think is very important. So yeah, that's all I had to say. Thank you.
Thank you. I think we have one final question here.
Thank you very much. Is it working? Oh, thank you, thank you. I just wanted to underscore something, and since most of the panel has already responded, maybe I should just make it a comment rather than a question. It's something that Anders said earlier on, that in actual fact, even though we have, in Africa, we have countries that are spending, are not meeting the Abuja target. We do have a critical mass of countries that are spending over $44 per capita on health. And we do have at least 10 countries where the out-of-pocket expenditure is 16% or less. Yet, even in these countries, the inequity between the spending on the rest of the population and youth is just massive. So I think the call here is for the restructuring of the health system. Yes, we have to look at new resources and where the new resources are going to go, but there is huge inequity. There is a social deprivation of young people of health, access to health services that is almost criminal in its nature in our countries. And I think that is the real tragedy of this. And it must be underscored as such. It's the deprivation as an assault on the youth by the health system and by our governments that has to be stopped. And it's in all our countries. I just wanted to underscore that we don't need to look for new resources, but it is now a social inequity and an injustice that must be addressed urgently.
Thank you for underscoring that very important point. I'd like to just turn it back to the panel for very quick closing remarks, if possible. And if you'd like to kind of share your final thoughts on what the key is to ensuring improved accountability. And Jonathan, I'd like to begin with you. or whatever final thoughts you have on,
Yeah,
on
no,
another topic.
No, I mean, I don't have a lot to add from what I initially said. I mean, I would just say that, you know, the important thing is to embrace transparency and not just talk about accountability, but actually live it. I mean, one of the things that we didn't talk about was, you know, specifically in Haiti, I've done a lot of work on the cholera epidemic, which, I mean, that's just been a 8-year accountability nightmare. First, the United Nations introduced cholera to Haiti, then the United Nations tried to cover up introducing cholera to Haiti. And then even after 6 years, when the previous Secretary General sort of grudgingly, under pressure from me, admitted that this had happened, there has been no actual accountability in terms of money actually, you know, making people's lives whole again and compensating, you know, families who lost loved ones and breadwinners. And that's one example of a place where, you know, we talk a good game, and the United Nations said some, you know, finally, after tons of pressure and protests and reports and investigations, said some nice words about accountability, but just doesn't want to do it, frankly, because the member states of the United Nations just don't want to part with the money, and people in Haiti don't have the power to force them to yet. So I would just underscore that, like, it's you know, I'm sure there are lots of different perspectives in this room, and lots of different people who have their hands on lots of different levers of power. But I would just put in a plug for not just using the word accountability over and over again, but actually being willing to put your money where your mouth is.
Thank you.
Nana, over to you.
Thank you very much. Citizenship engagement creates a responsiveness that ensures change. It bridges the gap of inequality. It ensures quality service. It ensures service that is provided for women with dignity. And so prioritizing and ensuring that it is on the agenda of programs and it is part of the integration to whatever service that is being provided, it's critical. It's important that citizens are engaged, because you cannot give me a T-shirt, for example, that it's a large or extra large when my size is a small size and expect me to use it. I may not use it. So for us to get the results we need to engage, and we need to engage the citizens, whether it's the adolescents or whether it's the women or whether it's the men, depending on the service we're looking at, or even the refugees or displaced persons. We need to engage. Thank you very much.
Thank you.
Just very quickly, thinking back of what Carmen said earlier, in the regulation of the private sector, you know, would be necessary even if things go well. But, you know, I wouldn't say regulation of accountability, but jointly continue to promote a culture of accountability with sound data at all levels, particularly local, inclusive review, and then remedial action that gives a voice to everyone. I think that's, listening to Jonathan, we're moving farther away from that. So I think we need to continue and strengthen our joint effort to get there.
Absolutely. Thank you. I'm afraid we're going to have to stop it there. Thank you all so much for joining this panel and discussion today. And there's lots of food for thought. I'm sure that conversations will continue. But a round of applause for the panelists. Thank you. And I'd like to now welcome Helga Fogstad to the stage for closing remarks.
Thank you. So before closing, and I know we are horribly late, but thank you for all of you still remaining seated. And so before closing, I have the extreme pleasure of, first of all, recognizing that this table here does not only have one sitting PMNCA chair, but 3 previous chairs, including the founding father. So this is, I don't know how this happened, but this is really great. So I'd like to please call on Machel. Mrs. Graça Machel, founder of the Graça Machel Trust and co-founder of the Elders, please.
Thank you so very much. It's always energizing to attend to these breakfasts, which have been for me a kind of inspiration in terms of having all the stakeholders together, giving the reports of what they're doing, energizing each other on how we can do better. So I want to thank you for giving me the opportunity of being with you, although I'm no longer the chair. And thank you, Machel, for your leadership. I want to be very brief. Just to remind all of us that our task is to end preventable deaths of mothers, newborn, children, and adolescents. It's to end, it's not to reduce. So in every meeting, every year, we should really have a sort of putting together where we are, and if we are to get to 2030, having ended. So really, it can't be a kind of just sitting, we have to do more. We have to say exactly what is the magnitude of what has to be done every year if we are to get to 2030. And we can report to the children of the world, to the mothers and adolescents of the world, that we have met our commitment. That's one thing I wanted to say. We were told here that the progress is, we have progress, but it looks like the progress is slow. And if I'm not mistaken, actually someone mentioned that at this pace, we could go as far as 2067. Did I hear properly? Yes. Did I? Yes. So if that is the thing, I believe we have a major problem. And we should look at this heads on to see how do we deal with the progress, which is slow, while we have really a huge commitment which we have made. So accelerate progress, but I think it's really to have the magnitude clear. A second suggestion I want to make is that we were told, and we know, that most of the challenges are in the so-called least developed countries. But we were also told that, fortunately, I think it's Anders who said, most of the resources for health now are generated at country level. So this is a good thing, because we have money, even if it's small, it's generated at a country level. And second, we can then focus in terms of doing the best we can at a country level. My point is that it is a decision which PMNCH has made already, but perhaps we need to focus really what is happening at a country level. Couldn't we think of something like a PMNCH breakfast every year at a country level? You know why? Because each one of the constituencies here has the knowledge of what is doing at country level. But I doubt whether all the constituencies are connecting enough with governments to make sure that there's a clear picture at country level of where we are, where are the issues of quality, equity, and dignity. How do we address them together? I doubt whether this is happening at country level. So I would leave this suggestion that we need to focus at a country level. The comment by my daughter here, we're just to the point. She was talking about young people, adolescents, but it would be the same if she was talking of mothers who are not adolescents. It would be the same if she was. So we have a crisis at the country level, particularly, you know, in the so-called least developed countries. So if we are to achieve this, I think we have to look at the 3 R's.
and accountability, but at every single country to see whether we will be able to. Now, finally, I was asked to draw your attention to the Partners Forum, which will take place in December from the 12th to the 13th. It's English now, huh? 13th in Delhi. The government of India has been kind enough to invite and hosting us, and we hope all of us will look at that opportunity where we will have 2 days of robust discussions and strategizing together to make sure that we really take this agenda and this strategy much more further, perhaps in the lines of what I just suggest, but the agenda will be improving multi-sectoral actions for results, sharing country solutions, capturing the best practices and knowledge within and among the health sector and related sectors. So I really would like to encourage you to come and bring in the best of your experiences. And from that point, I hope we will be able to have clarity. How do we get to 2030 having met our commitment? Thank you so much.
Thank you so much, Machel. So, dear PMNCH partners and friends, we have come to the end of this year's Accountability Breakfast. And it is a moment for us to reflect. Reasons we do this Accountability Breakfast. And it is not because we want to give you a free breakfast. It's an expensive breakfast. Just have to say that. So this is our mandate as in PMNCH. It is the PMNCH mandate within the Every Woman, Every Child architecture and our complementary role to our H6 partners and our GFF partner. We focus on accountability because we want to ensure not only to have quality data, but that it gets reviewed and that appropriate and necessary action is taken. In PMNCH, we are also increasing our validation of commitments. We are doing so, and this together with our FP 2020, GFF, UHC 2030, and our countdown partners, so that you increasingly will receive, hopefully, one day, less and less number of reports. And we will come together to ensure your collective attention remains focused for action. We are also increasingly looking beyond the health sector and the SDG 3. 50% of health happens outside the health sector, and so we need to join partners outside the health sectors in order to review and act together. We also come together not only to celebrate progress, but we come together to get angry. As RC said, the unjust unfairness that keeps on going should not be normal. It is unacceptable. You all need to get angry and motivated to contribute to do better. Each and every one of us has the moral obligation to take the messages of today and move in a better direction, so please join hands. So what can you expect from PMNCH? This event is a moment on the path to progress, and PMNCH is there to ensure accountability remains at the forefront of our collective efforts. We plan to make it more uncomfortable for all, where better action is needed. However, we also plan to celebrate and praise where success is accelerated. PMNCH is working to strengthen accountability on all fronts, holding all of us to account for better results, resources, and rights. We will increasingly validate the 3 Rs. We will set more emphasis on digital. We will strengthen and come together with partners to develop a toolkit to strengthen accountability mechanisms and gather more available case studies and synthesize success stories to share. We will continue to host independent accountability through the Independent Accountability Panel, to ensuring the voices of all of our constituencies are heard through the What Women Want campaign of WRA. We will want the voices of women, adolescents, and children to be at the center of everything that we do. We want to ensure that the countries are at the heart of everything we do. And so therefore, we do pledge in some way or another to also have an accountability breakfast in countries, drawing on the multi-stakeholder platform and ensuring appropriate representation of our constituencies that have not been at the table, which is civil society or the adolescents or the healthcare professional associations and so forth. So this is something that we will look at, looking and contributing to how that mechanism can be strengthened. This week, you will see some of our partners in action. I would like to especially mention the EVEC reception on Tuesday evening here at the West End and the IAP launch of their report on Thursday morning at the UN. In December, we will come together as a community at the Partners Forum. The Partners Forum is the General Assembly of the partnership. This is the highest governance entity of the partnership. We'll come together in order to reunite for further and better action. You will find this wonderful badge on your table. It represents the 6 focus areas, and they are all important and need of action in the SDGs. You will see that the logo bears the colors of the SDGs, but there are people on them. There's youth, children, women, men that walk together in all of these. Please wear the badge with pride. This is important to reflect where we walk together. I would also like to tell you that there is an accountability track in the program at the Partners Forum that will cover in greater depth some of the topics you heard about today. We plan to take every single aspect further. There will also be a 2-day pre-forum symposium with the CLAC consortium, and which we are looking at focusing on social accountability. Please contact our secretariat for more information. Again, these events serve as a stepping stone for all of us to fully engage in ensuring the success of and implementation of the global strategy. I'd like to now thank DevEx. Can you stand up, please? All of the DevEx here, because you have done a stellar job. And you have ensured a lively, engaging event this morning, and to all the organizers and also the speakers and panelists. And most importantly, you are here and those watching virtually. So we will also continue this at the Partners Forum. So lastly, I would like to recognize each and every one of you and what you are currently doing and what you potentially can do even more. And join us at PMNCH in doing the necessary for accountability. And I would like to thank each and every one of you, all the fighters for the results, resources, and rights, and wish you a wonderful week of UNGA. Thank you.